Good morning, everyone, and welcome to the House Committee on Health and Human Services and Elderly Affairs. As noticed, we have several bills scheduled today for executive session. But before we get into those, I'd ask you to please join me in the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you, everyone. Okay, the first bill for our consideration this morning is Senate Bill 355 FN. Representative Kofalt.
I move ITL on SB 355 FN.
Is there a second? Representative McLean, you second. Representative Kofalt, did you want to speak to your motion?
Sure. I think, my concern here is that we are sort of expanding the scope of recommended procedures for newborns. It is advisory, and yet advisory practices often carry a lot of weight. Advisory practices often morph at a later date into mandatory practices. I think that this is an unnecessary bill, and that is why I moved ITL.
Representative Weber.
Sorry. Thank you, Mr. Chairman. I oppose the ITL. I think this was an entirely benign bill that recognized that adding another screening procedure was not appropriate, and the encouragement for education is always the way that I think is the most appropriate way to go. So I will, for that reason, I would have preferred a motion of ought to pass, but here we are, so I am opposing the motion of ITL.
Yeah, thank you. Other discussion? Okay, well, I guess it's easy in that regard anyway. Okay, so the motion is ITL on Senate Bill 355 FN. I'll ask the clerk to call the roll.
Representative Kofalt,
Yes.
Representative Notter,
Yes.
the clerk votes yes. Representative McLean,
Yes.
Representative Seth King,
Yes.
Representative Mazur,
Yes.
Representative Nagel, I'm sorry, not here. Representative Polozov,
Yes.
Representative Weber,
No?
Representative McKay,
No.
Representative Freitas,
No.
Representative Cannon,
No.
Representative Nutter Upham,
No.
Representative Shapiro,
No.
Representative Merchant, Representative Murphy,
No.
Representative Palmer,
No.
Representative Tejas,
Excuse
and
me,
Representative McDonald.
Yes.
who is Representative Notter in for today?
Representative Cushman.
Okay, got it.
Sorry, I should have not. I believe that's the only substitute we have this morning. I don't know of any others.
And the vote is 8-8.
8 to 8. Okay, Representative Weber.
I would move ought to pass.
Representative Weber moves ought to pass. Is there a second? Representative Murphy seconds.
Should we caucus?
Um,
I'm sorry, who asked for a caucus?
I was thinking maybe it would be a good time to caucus now.
Are you requesting a caucus? Okay. we
Oh,
can-
I
well,
see.
I don't think that was the bill we were talking about needing a caucus for, was it? But, I'm
It's
sorry.
up-
Representative Tejas has arrived and we are no longer evenly split.
Oh, okay. All right. Yeah, good point. All right. All right. Well, we'll have a brief recess and Republicans will caucus.
Go.
Okay, we'll reconvene at this point. Thank you for your patience. The motion on the floor is ought to pass on 355 FN. Representative Leon, you wish to speak to this motion?
Yes, thank you, Mr. Chairman, and I apologize for not being here for the previous discussion. I was introducing a bill over in Senate HHS. I recognize the motivation and the importance behind this bill. One of the big things that we need to recognize, however, is that the largest indicator for needing a CMV test is failing the hearing screening. And the hearing screening is not part of the newborn screening. That is something that is done by the hospitals as good practice. Adding something to a voluntary good practice effort that's part of the newborn screening system that's required seems to be a little odd to me. Right now, we need to focus on the specific necessary need, where if there is a newborn who fails the hearing screening twice, they should be tested for CMV, and that should be standard practice across hospitals in New Hampshire. The fact that it's not is the problem, but I think one that through education, even without this bill, we can address. The idea of trying to wrap in something that comes after a voluntary step just seems to be not the right way to legislate. And I believe that that's why, had I been in the room, I would have moved ITL, because while this is an important, I recognize that. I represented one of our bills over in the Senate. Had I been here, I would have made that motion, because while it is important to understand the risks of CMV, there's also the risk of scaring parents needlessly for a disease that is highly prevalent, often does not lead to negative outcomes, and where antiviral treatment carries its own risks from that treatment. So the idea of telling a parent, well, your baby has this disease, nothing's probably going to happen. We could give them medicine, but that medicine might hurt them. That gives a parent who is anxious, nervous, and trying to do the right thing for their baby one more thing to worry about, when that's something to leave to the professionals and leave to their professional judgment. That's why I believe that while this is a well-intentioned bill, I don't think this is the right solution. And I think that we should look to a different approach. So thank you.
Representative Weber.
And I'm going to pick up on the point about education and just say that I think encouraging education is a good thing, and we should trust both medical professionals and parents, but this bill is encouraging education, and I'm going to vote for it. Thank you.
Other discussion? I'm seeing none. Okay. Motion is ought to pass on SB 355 FN. I'll ask the clerk to call the roll.
Representative Leon,
No.
Representative Notter,
No.
clerk votes nay. Representative Kofal,
No.
Representative McLean,
No.
Representative Seth King,
No.
Representative Mazur,
No.
Representative Nagel, Representative Polozov,
No.
Representative Weber,
Yes.
Representative McKay,
Yes.
Representative Freitas, Representative Cannon,
Yes.
Representative Nutter Upham, Representative Shapiro,
Yes.
Representative Merchant,
Yes.
Representative Murphy,
Yes.
Representative Palmer,
Yes.
Representative Tejas,
Yes.
and Representative McDonald,
No.
10 to 10.
Okay, so this will be going to the floor without a recommendation. I would remind everyone who'll be authoring reports that we're up against the deadline on all of these early bills, and that they all need to be in as soon as possible. Christina Dyer is in the back listening to this, and we'd be most grateful if we get these in by early afternoon, right? If possible. Obviously, as early in the day as possible. Also,
Mr. Chairman, I need to go back over to the Senate. I don't know if we want to do one with an amendment. I'll be back as soon as I can. Thank
okay,
you.
all right, thank you. I would like to announce, there was an early bill that escaped our attention. There was a data entry error in the clerk's office. It's the first bill we'll be hearing tomorrow morning, SB 352 FNA. Representative Weber and I met with the clerk, and we will be hearing that first thing tomorrow morning and execing it right after, because it is an early bill. They're holding the calendar for it, and again, we're up against that deadline. And I believe it's Representative Weber's Senate, excuse me, House Rule 44B. I think that's the one the clerk cited.
It's the one about firefighters.
Right.
Firefighters and cancer screenings.
And so we're in agreement that we will, and if the chairman and the ranking member agree, we can exec it tomorrow, even though it's not noticed, and otherwise the bill would have to be withdrawn entirely, and we don't want to do that. Representative Nuttarappam. Same time, it's actually the, yeah, whatever the calendar says. Yeah, 9:30.
Mhm.
Yeah, it'll be the same time in room 203. Yeah. Okay, so, and so again, yeah, reports, please get them in, right away.
Can I,
Representative Weber.
could I just say, I know that several of us need substitutes for tomorrow, so if you could let the Democratic office know, perhaps quick text, so that they can try and find you a sub if you need a sub. If you don't, we'll just go ahead and hope for the best and deal with it on the floor.
And likewise with the Republican office, if any of you, I haven't heard from anyone, but if anyone does need to be, have a replacement, please let the Republican office know and let me know. Okay, so we are down one. Okay. Well, we can at least start the discussion. Representative Weber, you're our parliamentarian, but we can at least start the discussion on SB 403 FN, I would expect.
We can start any discussion and hold any vote. The only thing that bars somebody voting is they must be in the room when the question is put. So when we get to the end of the discussion and we're going for a
Okay, so we
vote.
can have a general discussion, but no motion can be made.
Well, you can have a motion, it's just,
Oh, it's when
I
I
mean,
call
some
for the
people
roll.
have the motions first and the discussion afterwards. You can do it any way around. It's just if somebody, when you get to the point of saying the motion is ought to pass as amended,
And I
and
asked the clerk
somebody
to-
has not been and asked the clerk to call the roll, if they
Okay.
walk in after that,
All right,
they can't vote.
okay, great. All right, well, with that, thank you, Representative Weber. Let's go to 403, SB 403 FN. I have an amendment that the department asked me to offer, and I would move its adoption, SB 403 FN. Do I have a second?
Could we see it?
I distributed it at the last meeting last week.
Oh, okay.
It is
My bad.
Amendment 1533H. I passed it out as toward the end of the hearing on 495 last Wednesday. I don't know if everybody brought it with them or still has it in their possession, but it was distributed. I would think it would be on the website.
Might we have copies anywhere?
Okay.
Or might
Representative,
Ms.
Ms.
Dyer
Dyer
be
is
able
getting
to-
up,
get us copies?
It's not on the website.
I'm sorry about that.
I was looking at 104.
it hasn't been seconded yet.
Mr. Chairman, what was the number on that amendment?
1533H.
Thank you.
I guess I should have held off distributing the amendment, but I wanted people to see it in advance of this session, so. Ms. Dyer has left the room. I assume she's getting copies for us.
She took one, and there is a copy machine right back there, so.
We should have known it would be a challenging day when the sun didn't come out, right?
And I'm sorry, I mean, it's probably just me, so,
No, it's not.
it's not just me. Okay, thank you. That was kindness.
I was looking at the.
That was a kindness.
It was.
Who seconded the amendment?
I don't believe it was
For my notes.
seconded. Was
Oh,
it
we
sec-
hadn't gotten there yet?
Yeah, we haven't gotten there, yeah, because you pointed out that there was
I'm
no
sorry.
copy of it available, so.
Bless you.
Thank you.
Is it a multi-page amendment?
I think I saw him holding up a staple
Ah,
copy.
that explains it. And Representative Kofold said you might need one as well. I was looking at the wrong one. Thank you.
I've got a copy, yeah. Thank you, Christina. Okay. Christina Dyer once again comes through. Thank you very much. Okay, so I'll reiterate my motion of ought to pass on 403 FN. Do I have a second?
Second.
Thank you, Representative Merchant.
It was the amendment you were moving, not the.
Right, yeah, the amendment
thank
for
you.
1533H that Christina Dyer just distributed. I will, I'd like to add, we have an attorney here from the Office of Professional Licensure and Certification. I'd like him to come forward. I introduced this amendment at that request, and it was, with his help that I drafted it, and I want, anytime we consider any legislation, I want every agency to feel they've been given a fair shake and all information relevant to the issue is being considered. And for that reason, I was happy to introduce this amendment, sponsor this amendment, and this time I'll recognize the gentleman before us. Don't forget to put your microphone on, please, and state your name.
Sure. Good morning. My name is Douglas Osterhout, and I am General Counsel for the Office of Professional Licensure and Certification. I did craft the majority of the language, I believe, in this amendment. The purpose behind that is about 2 years ago, there was a study committee. Representative Merchant was on that committee, who made some recommendations about the roles and responsibilities between the Office of Professional Licensure and Certification and the boards we oversee. And we made some changes, or the legislature made some changes to that as far as fee setting authority, who issues licenses, that sort of thing. It's a work in progress. We had a very large bill last year that was around 200 pages. Parts of that bill or parts of the language were taken out. This year is sort of round 2 of just cleanup, making sure there's no conflicting language in statute. Originally this fall, we thought we were going to move forward sort of with wave 2 of cleanup. Then we were told no. Then in the spring, it ended up happening. So my original plan was to address any language that conflicted with SB 403, with the OPLC statutes in the bill we did next year. Since it ended up moving forward this year, I thought now would be the right time to make sure the language in SB 403 does not conflict with RSA 310 and the Board's Practice Acts. So basically, that's a long way of saying this is a very technical amendment. It doesn't change anything policy-wise, and it just makes sure that the language in here comports with the OPLC Practice Act and the Board's Practice Act. Happy to take questions.
Any Representative Merchant?
Thank you for taking the question. Correct. I think what I read in here is the clarification to who issues the license, but the standards for the license is controlled by the board. So the board is the one controlling the requirements for a license, but the actual physical issuing of the license is done by OPLC, not the board.
That is 100%
Correct, thank you.
correct.
Other questions? Okay, seeing, Representative Weber.
Thank you. I'm somewhat concerned
Sure.
at the late introduction of a change of this magnitude, simply because I have heard in the past that there have been times when the individual boards and the Office of Professional Licensure have not been entirely in agreement about where those boundary lines are. And so I'm very anxious about passing this without giving everybody the opportunity for a real full public hearing. That said, I do believe that the changes are technical in nature and it is going to another committee. So I fervently hope that anybody who has concerns with it will be given appropriate notice at that point. Because it's concerning that a shift like this happens without a significant amount of notice.
Representative Merchant.
Thank you, Mr. Chairman. Also, thank you for taking the question. On line 9, what was the impetus behind adding employed as a licensed nursing assistant for 1 full year? Where did that come from? Who wanted that language inserted? Because it goes back to what Representative Weber is saying. Is this something that OPLC is requesting or something the board is requesting? Because it's important. If it's requested by the board, it makes sense. Was the original bill?
What was sent to us from the Senate.
Okay, but again, go back to who was the one, because I wasn't here for the hearing. Who was the one that wanted it inserted?
It was not the OPLC.
Representative Weber.
I will just say that that was in the bill as it was sent to us from the Senate, so at least people had notice.
Representative Tellez, you had your hand up?
Thank you, Mr. Chair, and thank you for taking my question. We're trying to reconcile the amendment, sections in the amendment, beginning, where was it? Line 24 in the amendment says amend 326 and 3 as inserted by section 6 of the bill by replacing it. So I just want to make sure that that's not trying to replace all of section 6, right? It's just beginning on line 14 of the was it second or third page of the original? Yeah, I'm trying to understand the motivation. Like, what is that change pertaining to?
Having a little difficulty following the bouncing ball there. So
sorry.
if we're looking at the original bill, is that the
What
reference?
page is that? Page 2, line 14.
Page 2,
section
line
4.
14 in the original as it came from the Senate?
You talking about the amendment or the bill?
Yeah, I'm trying to understand the differences here. Again, going back to it's a lot of change. It's okay. Well, my first question was, you're not replacing the whole section 6. You're just replacing sections. So that wasn't completely clear. And then trying to understand where it says 326 and 3 rulemaking, there's a fair amount of difference between what was originally drafted. And so just trying to understand the spirit of those changes.
Sorry, you asked a question, Representative Tellez, right?
Yes,
Yes, perfect.
and he's looking and trying to find the,
I just wanted to make sure I wasn't jumping in the wrong way.
No. and could I elaborate while he's looking, just
Yes,
in
Representative
hopes of
Weber.
finding things? In the bill itself, or the bill as we got it from the Senate, it appears to me that if I look up 326:N3 rulemaking, which is what is being amended here, it starts with a very long list of things that are going to be done or not done. And that list doesn't seem to be in the amendment. So if you could walk us very carefully through that section, I think it would help a great deal of us. And it's on line 24 of the amendment, but if you page through the bill, it is section 6, and then when you go down to 326N3 rulemaking, it's got the same caption at least.
Yeah, apologies. That was line 14 of page 3, not line 14 of page 2 from the original bill.
Okay, I've found all of the language. I've also got notes explaining the decisions that I made. I'm just trying to line it up with my notes so that I don't have to do any guesswork.
I think we probably should stick to one and then we'll move forward with the other question.
All right. So if we're looking at 326N3, the rulemaking, the executive director in consultation with the New Hampshire Area Health Education Centers adopt rules pursuant to RSA 541A relating to the following. The certification is voluntary. It doesn't appear that there is a board tied to this certification in this bill. So it's more of a registry. So this is one of those cases where it's going to work more like an advisory board or other registries that we have within the office.
Yeah.
And the executive director will work with New Hampshire Area Health Education Centers to adopt rules relating to the following in the criteria. And I believe that is the language in the original bill as it was proposed. Section A would establishment and administration for a voluntary program for certification of community health workers. That stayed in the amendment. Minimum and continuing education, training, experience, and other qualifications all stayed in the bill. Forms, procedures for the receipt, review, and action upon applications, establishment of standards
just
for
direct into
continuing
a section?
education.
Could I interrupt you for a moment?
absolutely.
Representative Weber has a point of,
If
point
I
might help.
look at the bill as sent to us by the Senate, that whole section, 326N3 rulemaking, starts, the executive director shall in consultation with the New Hampshire Area Health Education Centers adopt rules relating to the following. And it starts out the same, okay. And then, I'm just trying to find out if this is a renumbering thing.
It's more of a redundancy thing.
But under the original bill, there's 4 sections and then subsections, and none of those appear to be in the bill as you're submitting it to us.
Correct.
And
Representative
so,
Leon, did you have additional information?
Yes, in the original bill, lines 24 through 36 are removed, but the rest of that rulemaking section is there. And the part about administering the fees, which is currently Roman 2 on page 4, lines 3 through 5 is gone, I believe, because that's included in the new N4. But in the rulemaking, it keeps lines 14 through 23 of the original bill, page 3, and then it keeps lines 1 through 2 on page 4.
So I can walk you through that too if you'd like. So
I think a walkthrough would be helpful on that because the section, the version of the original bill that I have is not lined. It doesn't have line numbers.
Representative Merchant, you wanted to speak?
Thank you. As we're going through this process, I'll go back to my question I asked earlier about the role of OPLC versus the role of a board. I have a real deep concern that when you talk about rulemaking, that the rulemaking is not going through the board review process. This is dealing with licensed nursing assistants, which come under the jurisdiction of the Board of Nursing, not OPLC. So in saying that, I would strongly oppose the fact that the executive director, who's not required to even work with the Board of Nursing, working with healthcare educational centers, and on top of that, when you start looking at what they're going to go through rulemaking, it goes through the requirements for that certification, which is the education, the training, experience. That belongs under a professional board and not the Office of Professional Certification, in my opinion.
Representative Tejas.
Yeah, sorry, this is confusing because there's too much in this huge bill. This section we're talking about is community health workers. That is not a nursing profession. It is a lay profession for which there has been many years of work towards creating a voluntary certification process. There is no entity that would be the appropriate entity, except now figuring out that somehow sharing that between the HHS, the AHECS, who've been doing all the work of the training for years, and the OPLC. So it's not nursing.
Then why are we calling it a licensed nursing assistant?
It's a different section of the bill.
Thank you.
Thank you.
Representative Leon.
Thank you, Mr. Chairman. My question is if there are other areas where essentially lay people are certified without an advisory board in order to set standards that are in vulnerable situations with people in the state. Is that something that's done in other sections of OPLC, or is this a novel pathway? Do you know?
It's rare, but it's not unheard of. I believe ophthalmic dispensers are a registry without a board. I believe there's proposed legislation. It's confusing. Some of it happened last year. This year it's getting assigned to us, but for lactate specialists and doulas would be a registration. There is an interesting, I'm just going to use the word thing, we oversee now with the traveling nurses, the companies that oversee traveling nurses now have to register with us. There is no board. So it's not a common thing, but it's also not unique.
Representative Leon.
Thank you. And as a follow-up, ophthalmologic dispensers, doulas, lactation consultants, all are not operating on their own. They're all in conjunction with other licensed professionals under a board, I believe, correct?
I'd have to look at the legislation for that.
from-
I mean, we haven't implemented like doulas and lactate specialists. They're not with us yet, so I have to see how those puzzle pieces fit.
Okay, but in their practice, they are. And then it would be the traveling nurse associations, not the
Correct.
nurses, which themselves are licensed.
Correct.
So this idea of having somebody go into somebody's home that's not directly overseen by somebody and providing health care is a step outside of what we've already have established, even if we are working towards it in other areas.
No, it's a new section.
I think the closest comparison here is probably ophthalmic dispensers.
Okay, thank you.
Yeah, yeah.
So I believe you were going through the bill and trying to clarify some things before we got into some questions, but if you want to resume.
Sure. So I'm on page 3 of the bill as
And this
amended
is
by
all
the
the
Senate,
community health
line
worker
24. So it would be 326 and 3,
And it's just added.
Roman numeral 1B, forms and procedures for the receipt, review, and action upon applications for initial community health workers, et cetera. This authority is already granted in proposed 326 and 31A, which requires the executive director to adopt rules for the establishment and administration of a voluntary program. So I believe the language just to be redundant, so I just removed it. Section C, right below that, establishment of standards for continuing education and other requirements. The executive director has regulatory authority under proposed RSA 326 and 3. The executive director is required to consult with the New Hampshire Area Health Education Centers pursuant to proposed 326 and 3 Roman numeral 1. My suggestion would be to add the commissioner to that list so the ED consults with the education centers and commissioner. That's what I wrote in my draft I sent to Representative McDonald. That's a policy decision, just a recommendation. Strike all of D, I suggested, because rulemaking authority for D already exists in RSA 310:6, Roman numeral 2. The E, the determination, assessment, and collection of certification fees, etc., already exists in RSA 310:6, Roman numerals 1 and 2. And F, other, well, I didn't change that. I just changed commissioner to executive director. So basically, it was just to remove any redundancy in the statute where the rulemaking authority already exists within the office in 310:6. So that was my goal there. One of the things we're up against, and the reason we have to do multiple omnibus bills, is whenever we make or grant that same authority in one place, if we put it in 2 or 3 places, we have to change all of it. The purpose of that consolidation in 310 was to avoid that trouble.
Thank you.
Of course.
Other questions? I'm seeing none. Okay, thank you.
Of course.
Okay, any other discussion on the amendment? Representative Nagel, did you want this
Yeah, I
gentleman or
do.
me?
What's an ophthalmic dispenser?
They
It's not in
dispense
here.
ophthalmics. I don't know. Sorry.
And
I believe it's is it contact lenses? I'm not entirely sure. I deal on the administrative side, not the scope of practice side, so I don't really have useful information.
it's
Representative
not part of the
Shapiro.
bill,
Well, it is in the sense that we're comparing the two.
right? But it's not part of the
If-
bill.
Mr. Chairman.
Representative Shapiro.
So in regard to your initial comments about aligning this bill with changes that are coming, would it be safe to say that across OPLC, the boards will not issue licenses and certifications? It will be OPLC? That's the technical
That's correct.
language?
Yes, sir.
Okay. And also,
Follow up.
in regard to Representative Merchant's question before about line 9, letter B, has employed as a licensed nursing assistant for 1 year. I think we heard during the hearing that makes a change from 2 years, which is not in statute, but is in rules. So it's kind of bringing down the standards so that more people can get this ability to provide a medication.
Thank you.
Any other questions for this gentleman? I'm seeing none. Okay, thank you. Any other discussion on the amendment, 1533H? Seeing none, I'll ask the clerk to call the roll. Motion is out to pass on amendment 1533H.
Representative Leon,
Yes.
Representative Notter,
Yes.
clerk votes yes. Representative Kofalt,
No.
Representative McLean,
No.
Representative Seth King,
Yes.
Representative Mazur,
No.
Representative Nagel.
Yeah.
Representative Pelosi,
No.
Representative Weber,
Yes.
Representative McKay,
Yes.
Representative Freitas, Representative Cannon,
Yes.
Representative Nutter Upham. Representative Shapiro,
Yes.
Representative Merchant,
Yes.
Representative Murphy,
Yes.
Representative Palmer,
Yes.
Representative Tejas,
Yes.
and Representative McDonald.
Yes.
16-4.
Okay, the amendment passes 16-4. And at this point, do I have another motion? Representative Kofalt, did you have a motion?
Yes, I move ITL on Senate Bill 403.
Second.
Representative Leon seconds the motion. Do you wish to speak to your motion, Representative Kofalt?
Yes, I am very concerned with the creation of a new licensure position, community health workers. I'm concerned especially about some of the definitions offered here, including, for example, in providing informal and motivational counseling. So motivational counseling, I think I understand. Informal counseling, I think is very poorly defined. There is another provision in this that says they shall not perform any duties that are performed by somebody who would require other certifications or licenses. So I think this is an extraordinarily fuzzy definition. On line 28, it says that community health workers would provide other services as defined by rulemaking. That seems to me to be a wide open door. So while I think we heard from some people who are community health workers that they are very committed to their jobs, they feel like they're making a difference. I guess I would ask the question, how do we know that this is truly effective? How far will the government reach into people's lives? We heard one person attest to the fact that she was helping people with things like advising them to tape down a carpet so they don't trip over it. And just as importantly, perhaps, how far will government reach into people's pockets? Because somebody has to pay for this. And this bill creates a reimbursement mechanism in which we would be paying for people whose responsibilities, I believe, are extraordinarily vaguely defined, open to expansion through rulemaking. And I just think that this is a bad precedent to set.
Thank you. Representative Leon, did you want to speak to your second, or?
Yes, Mr. Chairman, thank you very much. So this is an area where we need to look at what we're doing, what powers we're giving, and most importantly, what we're making the public see when they see the certification. With this certification from the state and the ability to bill, people are going to expect a lot out of these community health workers. They're going to expect that they're going to be able to do a lot of things to help them out. Quite frankly, when we had involvement with them, with family members in California, we expected a lot out of them. We expected too much. Even though it was a regulated profession there in California, they did not add to the situation, and they delayed the ability to get more appropriate care for a loved one because there was an expectation that they were providing care and help that they were not. I'm very concerned for our elderly residents if they think that this is somebody who's going to come in and be able to do things that really should be in a licensed, regulated health worker, especially in their home, especially with vulnerable populations. And further, when we look at this, we see that this is creating something that's on par with ophthalmologist dispensing, which is the design, verification, and delivery to the intended wearer of lenses, frames, and other specially fabricated optical devices based on a prescription. That's a big jump, going from the person, which is a very important skill to make sure that somebody's glasses are correct and their contact lenses are correct, to being that trusted person in somebody's home that they rely on as their contact to the health system. I think that this is something that will touch our most vulnerable people. And I think that moving through with this, where we even have questions on how to regulate it, how to deal with it, is too much. There had been a question of, in my mind, should we interim study this so we can work through it? But this is such a large and complex thing that it would be even hard for this committee to meet in the remaining time and in the fall in order to come with an approach. I think we'd be doing it a disservice to try and do this. I think that it's something that we need people to work outside of the legislative process and try and understand this better, get groups together, try and figure out specifically what's been needed, look to what's worked in other states, look to how people in California have been misled because they thought they were getting a health worker, but they weren't. And make sure that we don't repeat the mistakes of other states. So while I'm very compassionate to the idea that, and the recognition that community health workers do a lot of good, I think that this professionalization without the underpinnings does a disservice overall. And I don't want to demean anything that people in the community health workers are doing. I just want to make sure that we're not putting out false hope to our vulnerable people.
Thank you. Other discussion, Representative Merchant.
Thank you, Mr. Chair. I do concern myself with one aspect that maybe was talked about with the hearing. I apologize to the committee for not being here. We talked about in Senate Bill 495 the issue of abuse. So I think there's two parts to it that I concern myself. One is the competency of the person doing it. The other thing is ensuring that the people that they're providing the service to are not being abused financially, physically, or otherwise. And I think that's one of the concerns I have here is that if we do go forward, it's voluntary, which makes sense. But I don't want that certification to be held up to a patient or to somebody else thinking that's a gold seal of approval, and they let the guard down. And all of a sudden, we open them up to the possibility of abuse. Again, financial, physical, or otherwise. So that's one of the deep concerns I have with the way this bill's written.
Representative Palmer, you had your hand up?
Yes.
Oh, I'm sorry. Okay.
So I have
Representative Tejas next.
first, oh, okay.
Go ahead.
I have a couple of issues. One, I really don't like the fact that so much is crammed into one bill because there are other parts of this bill that I think are extremely important. Though I think the Commission on Primary Care was covered in HB 1609, and I'm hoping that that will go through regardless. The other one that is really important is the Nurse Practice Act statute, trying to get more coverage for everything. As far as the community health workers, I mean, I agree that this bill is hard to understand. I would just say that those people have existed, paid for by grants and other institutions, and are a really key part of delivering healthcare well, and we somehow need to figure that piece out and get it covered, because it does, in the long run, make a big difference in whether patients who are being discharged from the hospital or just have complex medical problems actually get the care that they need to get at home. But it's problematic.
Okay, thank you. Representative Tejas, sorry about that.
Thank you, Mr. Chairman. So community health workers, as Representative Palmer stated, exist. They've been with us, well, they're internationally, they exist and are relied upon in the U.S., at least in New Hampshire, for at least 15 or 20 years, we've had community health worker initiatives. The problem has been they're, not sustained if they're grant funded, programmatically here, there, whatever. Anna Thomas, head of the Manchester Health Department, spoke a few years ago and said, we need an army of community health workers to meet the needs that our communities currently have. Community health workers are lay community members. They are trusted members of their community. That's why they're effective. It has nothing to do with clinical knowledge. They do not pretend to be clinical providers. What they do is they connect people to resources. They help people identify where to go for help, how to get connected. They meet people where they are in community. Maybe they sometimes go into the home, but it is a profession. There are professional standards. And what this certification process does is just do what most states have done across the country, and it has been written with the best practices recognized and recommended from across the country, which is that it be voluntary, and that there be an advisory entity. And the only thing that has to do with the ophthalmic thing is is nothing except the fact that they have some kind of advisory structure that would mirror what's being proposed here. And so the Association for State and Territorial Health Officials and many other people have demonstrated that the return on investment is easily at least 3 to 1, if not 15 to 1. They're low-wage workers that make a huge difference in plugging the gaps in the health system, which we have all collectively agreed is very problematic. And I know of no instances of any CHWs being anything but incredibly welcome and valued by patients and community and family members, and would strongly urge that we pass what has been worked on for a very long time by a very broad range of stakeholders from all over the state, from the North Country to health providers, to community organizations, to public health departments, so that this can be a sustained workforce that is valued as they should be.
Thank you, Representative Weber, and then Representative Leon.
Thank you. I agree with everything that Representative Tejas said. I have a couple of, I want to emphasize that comparing this to a different profession that is equally not supervised by a board is a false equivalent, because they're just different. One of these things is not like the other. I also want to remind people that what we heard at the hearing, or what I thought I heard at the hearing, was the issue of keeping people in this profession, which is very helpful and very useful. And often there's a grant and they have a job for a year or 2 years, and then the grant ends, the job ends, the help ends. So a patient who has had a good relationship with a carer loses that carer. And in addition, the carer may go somewhere else and may not have this, they may work at a different employment altogether, and we lose that caring and expertise. So that was a problem that led to this. I also want to caution about relying on our own individual family situations to make make policy across the board, because there are all kinds of different situations in all kinds of different states. The one that my family went through was an elderly aunt of mine who did not live in the same state I did and was unwilling and was, well, she just didn't live in the same state that I did, and was horribly taken advantage of by completely unregulated carers, with nobody looking over the shoulder or taking into account what might have happened at another house and therefore shouldn't go to the next house. In any case, I think that regulation in this case is better than non-regulation. So I will be opposing the ITL. Thank you.
Representative Leon.
Thank you, Mr. Chairman, and thank you for these different statements. First, I wanted to key on to Representative Tellez speaking to community health workers as trusted community members. I think that that's very important, but we also need to understand some of those consequences of trust. And I want to key into what Representative Merchant said. So I'm on the subcommittee on Alzheimer's disease and other related dementia. At the last meeting, the New Hampshire Elder Abuse and Financial Exploitation Unit from the Attorney General's office gave a presentation in which 1 in 10 older adults are victimized each year, with only 1 in 24 reported. 60% of abuse and neglect comes at the hands of family members, but where does that other 40% come from? Caregiver neglect, whether it's family or not, is the most common form of neglect, and only 1 in 57 cases of caregiver neglect are reported. So there is harm that is happening in the state. They're following up on those resources. We have elder abuse and financial exploitation. We had a daughter-in-law that stole $102,000 from a family member with early onset dementia, and she was convicted and sentenced. We had a son that sold $325,000 from a parent that had lacked capacity because they had dementia with Alzheimer's type, and they spent 5 to 10 years in the state prison. We had a brother and sister-in-law that sold $90,000 from a woman who had dementia, and at the time of the trial, she was deceased. And those defendants spent a year in the New Hampshire State Prison. This is something that is a concern and is being worked on in the Attorney General's office to make sure that we are protecting our vulnerable adults, our vulnerable senior citizens. And given that the reporting rate is so low, and given the fact that we have these community workers already here, which is good, but adding a whole nother layer to it by making it an institutionalized process where people will say, great, we have this, they're licensed by the state, I can trust them. That we already have significant issues, and I'm just concerned about what's going to happen to our elderly Granite Staters, because the information from the Attorney General's office says that it is a problem here.
Okay. Any other, Representative Shapiro?
Yes, I'm going to vote against ITL, and I think this is an initiative that's well worth us pursuing. It speaks to two issues that are brought up here all the time. One is the workforce shortage. 3 issues. One is the general dysfunction. A second one is the general dysfunction of our provision of medical care in the state and in the country. And third, the issue of trust. And I would just like to distinguish, my feeling about the issue of trust from the previous speaker, which is there's been a lot of talk about the public not trusting the healthcare system in general and not trust. And we know there's been a lot of issues that have come down from COVID, which has eroded trust in the healthcare system. Whether I think it should or not, it clearly has. And I think that the key aspect of the community health workers is that they are people who are in people's community, who people can relate to, who may speak the same language as them. And I think this will go a long way in terms of increasing the trust between the healthcare system overall and individuals who are being served. And I do acknowledge that people can be taken advantage of, and they can be taken advantage of by physicians who are licensed by the board. They can be taken advantage of by relatives. by the mailman who delivers mail. So I think that the advantages to having people who people can really relate to, helping them with everyday activities, really for me trumps the danger, which is already clearly there. So I will vote against ITL and hopefully vote for or to pass on this bill.
Representative Tellez, did you started to put your microphone on, but any other discussion on, yes, Representative Murphy.
Thank you. It's nice to be able to push the red button here. As you know, I've been away for a little bit of time, and what you can
Welcome
really
back.
do, thank you. But what you really do is you notice, and maybe you're a bit more heightened awareness to what is said. And I first came across community health workers almost a decade ago up in Plymouth, New Hampshire. And it was impressive to me how they work within the community. They have the trust of the community. And during that past 10 years, I've also seen the decline of the trust necessarily in healthcare providers. So I've seen this group of community healthcare workers have a trust, quotient go up while healthcare providers has gone down to some degree. Whether I agree with that or not is another story altogether. But what I did hear when this bill was introduced over the past couple of weeks was the concepts of the social determinants of health. So what these people are doing, they're not going into your house and prescribing medication. They're making sure that your electricity bill was paid so that your insulin in the refrigerator is on. They're arranging rides to get to appointments. They are basically helping with housing issues. They are helping with medication issues. They're helping with getting a prescription from CVS. And I also heard a primary care provider saying, we need help. And so if there's any lack of trust in the primary care providers' offices, in large part, it's because they can't get access to these people, whereas they can get access to a community health worker. So these people need help. It keeps them out of the doctor's office. It keeps them out of the hospital, which, having recently been there, is very expensive care. And so what I would say is that, yes, the bill has a lot of, entanglements to it. I appreciate the amendment that was made because I think that does help it quite a bit. But what I'm saying this is basically is my experience with the listening and what I hear, but also more importantly, what I saw with the community health workers. At a tertiary care medical center, sometimes you don't get into the weeds with what happens at home. But having worked at a community hospital for the past 10 years of my career, you really become aware of the value of the community health worker and what they do to a family and what they do for a patient. So I will vote against the ITL. I understand that the bill may have a lot of complicating factors to it, but much of it I agree with, and the amendment only makes it better. So I will vote for hopefully what will be an OTP motion after this one is.
Thank you.
Thank you.
Any other discussion? Representative Nagel?
And this is probably more of a comment than anything, but I just find this bill kind of a sad statement of modern society. I mean, my mother used to do this when we were kids. We lived in ethnic and, neighborhoods and churches, and people just reached out and made sure that you had what you needed. You could recognize in a second when somebody needed something. The problem is it doesn't happen like it used to, and it makes all this almost a necessity, which I think is sad, but it's real. And I do have a gentleman in our nonprofit that does this. He's saved a lot of people's lives, and the guy walks on water to me. Totally uncertified, really probably shouldn't be doing what he's doing. So something that will empower him means a lot to me. Thanks.
Representative Merchant.
Thank you, Mr. Chair. I want to follow up on what Dr. Nagel is talking about. One of the concerns I have also, even though this is voluntary where it leads to, I want to be sure that people who work in those arenas that Dr. Nagel or Representative Nagel talked about, whether it be from the church, the community itself, and so forth, we don't somehow inadvertently create a problem where they can't do their job or help somebody out because they don't have the certification, even though it's quote voluntary. So then all of a sudden, people looking for it and asking, are you certified? And the answer will probably be no, because it's not required. So therefore, is the patient in a quandary saying, oh, you're not competent to do what you're doing. So I really wrestle with that in the marketplace and saying, it's one of those things where you've got a seal of approval that somebody's looking for, which is probably not needed completely. Yet the patient's looking at it and saying they're in a quandary because at that point in time, I'm looking for the seal of approval, yet you don't have it, but you can still do a lot for me. You come from the church, you come from other places, if you will. And that's one of the things looking for within the realm of the patients, particularly elderly patients. They're confused. They need to have the ability to get the assistance and help that they need from trusted sources and not just rely upon certification. That's also in conjunction with the issue I have with using it as a shield to somebody who wants to abuse an elderly patient physically or financially. So in saying that, I will support the ITL.
Representative Tellez.
Yeah, thank you. I want to make it really clear, these are not caregivers. These are not, you don't have a CHW in a longitudinal relationship unless there's something else going on. There are two really well-established community health worker training programs that were modeled after very long-standing effective community health worker training programs in other states. There are hundreds of people who've gone through the programs. They get trained, maybe they get hired for a job, and then the funding runs out, and then they can't continue in that professional role, which is really, really valued. It is at the doctor's office, maybe you realize the primary reason a patient is struggling is because of their food insecurity, but the doctor's office is not equipped to address that. But maybe they then make a call to a community agency, or maybe they have a CHW in the office or a partnership so that somehow or other, someone in this role, whether or not doesn't matter where they're stationed, like who's giving them their paycheck, but somewhere, how or other, someone whose expertise is to help address their primary needs, get them connected to resources so they can be healthier, is available, their being available is really valuable. And there's something else you said and it slipped my mind. There are, there's a whole set of work that's been done across the country to have established competencies, to have, recognized qualifications. And so the reason this is voluntary is because there are people who've been doing this work for 20 years. And we let the CHWs tell us whether or not they wanted to move forward with certification over the last at least 5 years. There are people for whom saying, well, you have to be certified maybe for certain kinds of compensation. And so that's why we're ending up with the bill that is presenting this as an avenue for certain things, like maybe reimbursement by certain mechanisms. But the certification in and of itself isn't necessarily going to change someone's rate of pay, right? It'll just be an additional credential, but some people have 20 years of experience and goodwill that they've garnered, and that's enough of a credential. So that is why it's voluntary, and the kinds of concerns that are being raised are handled by other processes, like you get other kinds of training if you're working with elders or working out of a elder social service agency, right? There's additional competencies and education and credentials that can be provided.
Representative Weber.
Thank you. And I just come back to two fundamental principles, because I hear the concern that everybody has for elders and not being taken advantage of. And those are all very real and very concerning issues that happen right now. And so it seems to me that establishing more accountability, not leaving things the way they are, is a good thing for number one. And number two, encouraging this workforce, which we all agree is necessary, is another good thing. And that's why I'm going to vote against the ITL. Thank you.
Representative Shapiro.
Yes, just in regard to the opportunity for people to take advantage of other people. I think, yes, these people would not be attached to a board, and maybe at some point that would be a good idea. But from the discussion, it sounds almost like we're assuming that these people will be operating as independent agents and going into people's homes. But there'll be other guardrails. All these people will be working for organizations that have, policies, that have supervision. People will be working as parts of teams. So I think that while I understand the concern about people taking advantage of other people, which obviously we heard a lot of examples of how that happens with a variety of people. It's not like these people will be independent agents going into people's homes, free to take advantage of people. They'll be working under supervision as part of an organization.
Representative Leon.
Thank you, Mr. Chairman. I just wanted to bring up two things. My question would be whether these groups that they're working for are regulated by the state, because we ran into the challenge with the sober homes having people that had an administrative role not having accountability for what was done. So if there's not similar accountability through whoever is employing the community health workers, we're just creating another area where people think that there are safeguards in place that may not exist. The other is there's confusion over this. Representative Tellez is a subject matter expert in this as far as I'm concerned. And she had stated that this is not longitudinal care, yet Representative Weber was talking about the importance of people in this role continuing to see individuals that they already have a relationship with. I know that it can have different situations and different scenarios, but my question too is we want to encourage people to be involved in the healthcare workforce. Maybe there's a reason that as a grant goes away, we bring people into stepping up another level of care so that they can join the workforce and provide even greater levels of care if they're so interested. So I think that while it's well intentioned, I just don't think this is ready for prime time at all. Thank you.
All right, we've covered it pretty well. Anybody got anything new? Seeing no one else. Motion is inexpedient to legislate on Senate Bill 403 FN. I'll ask the clerk to call the roll.
Representative Leon.
Yes.
Representative Notter.
Yes.
Clerk votes yes. Representative Kofal.
Yes.
Representative McLean.
Yes.
Representative Seth King.
Yes.
Representative Mazur.
Yes.
Representative Nagel. Representative Polozov.
Yes.
Representative Weber.
No.
Representative McKay.
No.
Representative Freitas.
No.
Representative Cannon.
No.
Representative Nutter Upham.
No.
Representative Shapiro.
No.
Representative Merchant.
Yes.
Representative Murphy.
No.
Representative Palmer.
No.
Representative Tellez.
No.
And Representative McDonald.
Yes.
10 to 10.
Okay, do I have another motion?
Anybody but me?
Okay, Representative
Go.
Weber or Representative Tellez?
I'll defer to Representative Tellez.
Okay,
I
Representative
move out
Tellez,
to
you have a
pass.
motion.
Ought to pass as amended.
Okay, okay, Representative Tellez moves
And
on.
I will second.
Okay, and Representative Weber seconds. Any other discussion, or do you want to speak to your motions? I think we've covered it, but Representative Tellez, you have anything additional? Okay. All right, I'll ask the clerk to call the roll. Motion is ought to pass as amended on Senate Bill 403 FN.
Representative Leon.
No.
Representative Notter.
No.
Clerk votes no. Representative Kofal.
No.
Representative McLean.
No.
Representative Seth King.
No.
Representative Mazur.
No.
Representative Nagel. Representative Polozov.
No.
Representative Weber.
Yes.
Representative McKay.
Yes.
Representative Freitas.
Yes.
Representative Cannon.
Yes.
Representative Nutter Upham.
Yes.
Representative Shapiro.
Yes.
Representative Merchant.
No.
Representative Murphy,
Yes.
Representative Palmer,
Yes.
Representative Tejas,
Yes.
and Representative McDonald,
No.
10 to 10.
Okay. Another one that will go to the floor without recommendation. Next up is Senate Bill 409 FN, and Representative Weber, I know you have an amendment for that.
Thank you, Mr. Chairman. I've got to shovel through my piles here for a moment.
Sure.
Yes. Timmy? They went around that, are there extras that went around that way? They're still being passed out.
Yeah, they did pass through here, so.
Is this all of them?
We have some here. I think there's some more over there.
If you have still three, then I think we're okay.
No, there'll be two reports on each because it's 50/50. Okay. Obviously, both on regular calendar. Representative Weber, do you want to make a motion?
Yes, please. I'd like to move the adoption of Amendment 2024-1563H, and I'd like to speak to that if I might.
Okay, is there a second to the motion?
Second.
Representative Nutter Upham, Representative Merchant, I'm sorry, seconds. Everybody's hand went up at once. Representative Weber, you're recognized to speak to your motion.
Thank you. You remember when this bill came to us, it had a list of about 5 things, and it said in the text that all 5 of them had to be present for Medicaid reimbursement to happen. So I made several changes. Mostly I kept those things the same, but I rearranged the wording. The first, the first change that I made to what was given to us comes on line 1112, and I made it specific that providers shall be eligible for Medicaid reimbursement when the provider has documented the following, because I know there were concerns about documentation, and I didn't want to make that too narrow, and I certainly know that Medicaid has a lot of documentation anyway, but I want to be sure it is documented, so that's just in there. So on line 13, it's required that the response originated through an emergency call, which is a little broader than 911, but still keeps the issue of this is not in connection with a transport between facilities or something. It's an emergency call. In all cases, the patient has to have consented to evaluation and treatment, and then only one of the following 3 things has to happen. Either A, after the evaluation and when indicated treatment, the paramedic or EMT and the patient agrees there's no need for transportation. That's number 1. And in all of these cases, I mean, services have to be rendered because you can't bill for them unless services are rendered. So it doesn't say that again and again, but that's a requirement that's already required by Medicaid. Secondly, the patient does not request and actively refuses transport to an emergency room for evaluation. So that would be when the patient and the EMT disagree on the need for transport, but the patient has a right not to be transported. It doesn't mean they haven't been evaluated and treated. And C, the patient, this is a combination of 2 in the original bill, and it says the patient is stable for referral to physician, other community resource, and the patient has the ability, including mental capacity and transportation resources, to obtain assistance and medically indicated follow-up. So, they have a plan, and the plan is capable of being followed out. So one of those three, A, B, or C, has to happen. And then we had the issue of reimbursement after assistance treatment had been given but was unsuccessful, and the patient was not resuscitated. So the last part says providers shall also be eligible for Medicaid reimbursement when the provider has documented that the response originated through an emergency call, resuscitation efforts were terminated, and the patient is deceased, because you can't have any consent under those conditions. So I hope that will meet with your approval. Thank you.
Representative Merchant.
Thank you, Representative Weber. Thank you, Mr. Chair. In regards to resuscitation efforts were terminated, so is this basically at that point in time, the efforts to resuscitate somebody could be terminated because they were resuscitated, but the patient didn't become deceased? Is that what I'm reading it? I want to be clear.
Well, it says when the provider has documented, first of all, the response originated through an emergency call, resuscitation efforts were terminated, and the patient is deceased.
Is it all three of those?
Yeah, I would think so. And certainly, unless I'm remembering certain issues with people with DNR at home orders, and I can't remember the name for that, but my understanding is that if there is a need for resuscitation, the EMTs will do that unless there is some kind of it's a pulsed or other order saying that they're not going to.
Thank you.
Representative Kofal.
Thank you. So I guess I'm just wondering if a technical adjustment might be required. Many years ago, I actually was a certified EMT in Massachusetts, and recall being called to a home where the patient was deceased when we arrived. I think that this is actually a fairly common scenario. And so my question is whether or not we need to adjust the language to say if resuscitation was terminated, if initiated. Again, I may be nitpicking here, but I would think that if emergency services are called to respond, and the idea is that they ought to be reimbursed for that, whether the patient is deceased when they arrive or sometime shortly after they arrive, should not affect the material outcome.
Representative Weber.
I can't guarantee it, because what I did was I took two clauses which were dangling off of other things and put them together. But I think, first of all, if you walk in and you have determined that the patient is deceased and that resuscitation efforts are not going to be availing under whatever those circumstances are, so I'm not going to speculate, then you haven't started treatment. And there may have been an evaluation, but I'm pretty sure that the underlying Medicaid regulations about what you can bill for will cover this, but I can't promise that. And if somebody wanted to come up with a floor amendment where the drafting was more artful, I certainly would be glad to at least consider that. But I am very much hoping that we not, in this case, make the perfect the enemy of the good, because it is a big problem that this will help a lot, and we can certainly revisit it as soon as next year.
Other discussion? Representative Seth King and then Representative Murphy.
Thank you, Mr. Chairman. I just wanted to thank Representative Weber for, I think, vastly improving the logic of the code here. It scratches that itch of mine, so it's very nice. But I do think Representative Kofal brings up a good point in that there are a lot of people who will be resuscitated right then and there and still actively refuse to go to a hospital. That does happen quite a bit. My understanding is, especially with people that overdose, they don't want to go to a hospital. So that could encompass quite a few people. Something to think about.
Representative Weber?
And in that case, the people who did the resuscitation would be compensated because you're not under that last piece. I just wanted to make it clear that in that case, they would receive, they can bill for the treatment that they gave. And that's scenario B that's covered here.
Representative Murphy?
No, thank you, Mr. Chairman. I was just going to say that, in section A, to Representative Kofal's question, if there's an evaluation and the patient is deceased, then they should be compensated for that. So basically, they have done an evaluation. It's not an easy thing always to determine, deceased versus not. But if they did an evaluation and the patient is cold, stone, dead, then that's an evaluation that they've done and should be compensated for that. So I would hope that that is addressed in that language.
Representative Kofal?
So I think we have, there's sufficient comment at this point that there is at least some legislative intent in that direction. Perhaps I will reach out in the coming week or so to somebody in the department to determine whether or not this would be reimbursable given the current language. And then if anybody is interested in potentially bringing a floor amendment with me to address that, I would invite you to do so. Thank you.
Okay. Other discussion? Take no other discussion. So the motion is out to pass on Amendment 2024-1563H to Senate Bill 409 FN. I'll ask
Mr.
the
Chair?
clerk- Yes.
Do we have to vote on the amendment first?
Yeah, that's the
Okay,
motion is out to pass on the
out to
amendment.
pass the amendment.
Representative Leon,
Yes.
Representative Nodder,
Yes.
clerk votes yes. Representative Kofal,
Yes.
Representative McLean,
Yes.
Representative Seth King,
Yes.
Representative Mazur,
Yes.
Representative Nagel, Representative Pelosi,
Yes.
Representative Weber,
Yes.
Representative McKay,
Yes.
Representative Freitas,
Yes.
Representative Cannon,
Yes.
Representative Nutter Upham, Representative Shapiro,
Yes.
Representative Merchant,
Yes.
Representative Murphy,
Yes.
Representative Palmer,
Yes.
Representative Tejas,
Yes.
Representative McDonald,
Yes.
20-0.
Okay, amendment passes 20-0. Representative Weber?
I was going to say I would ask that we put it on the consent calendar with the understanding that if an amendment is to be forthcoming, if an amendment actually is there, I would be glad to join with others in making up the 10 people to take it off consent.
It has $1
we-
million
we still-
Oh, I'm sorry.
appropriation as
I do
well.
that all the time, Representative Weber, so you make me feel good. when
My
you just did it.
apologies. Thank you, Representative Mazur.
I do that all the time, so thank you for doing it, Representative Weber. Make me feel better. Do you have a motion, Representative Weber? Now?
Well, I guess I do. I would like to move ought to pass as amended.
Okay. Is there a second? Representative Nutter Upham seconds. Any other discussion? Do you wish to speak to that motion, Representative Weber? Or
No, thank you. I think we've done that enough.
any other discussion on this motion? Representative Palazov and then Representative Seth King.
I like the intent of this bill to reimburse for unfunded mandates, but I think it goes from the wrong direction. We need to which those unfunded mandates, and as we just heard, like, we are not clear what exactly this bill is amended will be covering, so it's hard to evaluate how expensive it will be, and it looks like it will be expensive, and we don't know how much it will potentially save. So I think it's not ready for prime time. So even though I like the intent, I will vote no.
Thank you. Representative Seth King.
Thank you, Mr. Chair. So I'm going to be reluctantly voting no on this bill. I understand all the reasons why somebody would vote for this bill. I think there's a lot of good cases to be made for it, but my issue is a little different. And that is that we heard in testimony that several states have already done this. And the way I see it is that when it comes to grabbing for federal dollars, it's kind of like playing Hungry Hungry Hippos, that if you decide to be a state that doesn't want to participate in the game, you're going to lose all the marbles. And the other states that do participate will get those federal dollars. So it really is only a matter of time before all the states join on and do this. But the problem I have is that I think a lot of people don't really realize how it's being paid for. We say, oh, well, instead of paying it for local taxes, we're paying it with federal taxes. But in reality, we're not paying it in federal taxes because most people don't understand that 2/3 of all the dollars in existence are outside of the United States. And when the federal government runs a deficit, they print dollars out of thin air to pay for these bills. So what we're effectively doing is we are inflating the currency, we're destroying the value of it, and people that live in countries all around the world, including poor people, they're seeing the value of the dollars that they hold lose value. And so what we're really doing is we are charging people in poor countries to pay for the welfare in a rich country. And I think that is totally immoral. I don't support it. I understand why it all makes sense on paper. And I don't think there's anything I can do to stop it because our appetite for federal dollars is insatiable. That being said, I don't feel like talking about this on the House floor. So I'm willing to do consent calendar. I'm not terribly opposed to the bill. It's small potatoes compared to all the things we blow our money on, but it's the principle that really bothers me. Thank you.
Representative McLean and then Representative Merchant.
Yeah, thank you, Mr. Chair. I mean, I think it's immoral to mandate somebody come out and provide a service and not pay them. So I think that, you know, they're providing a valuable service. They need to be compensated for that. It's not right that you mandate somebody do something and that you not compensate them. And I understand the concern about the dollars, but there was also some discussion in the work session where another benefit of this is the opportunity to go out there, do an assessment, render immediate care, and keep people in their home and maybe prevent them having to go to the hospital in the first place. So I think, you know, we're going to have two bites at the apple because the House bill passed, and so I'm going to be supporting the bill. Thank you, Mr. Chair.
Representative Merchant, then Representative Shapiro.
Thank you, Mr. Chair. Following up on Representative McLean's comments, I do concur to have something mandated and not pay for it is an unfunded mandate. That's fundamentally a concern. Number two is that when it's unfunded and it's a mandate, it falls down to the local property taxpayer. And we have property taxpayers struggling in our state to continue to downshift responsibility from the state who mandates this or the federal government that mandates it and not support the local property tax base, I think is unconscionable.
Representative Shapiro.
Thank you, Mr. Chair. I've never played Hungry Hippos, so but I'd be glad to try it if you brought it in. I appreciate, Representative, your principled stand, but I think probably what you're saying is the same could be said about any federal money that we accept and pay for. And I certainly do have a philosophy of government providing a broad safety net for people. So I will support the bill. I also have a question for the chair, which is whether this actually can go on the consent calendar, because there is no appropriation in the bill. I had written an amendment with an appropriation, but I have not introduced that So currently, there's no appropriation. That would have to be done by the Finance Committee, or they would have to extend the date at which the bill took effect. So my question really is, can we put it on the consent calendar since currently there's no appropriation in the bill? There is the fiscal note, which says an approximate amount of money that it would cost.
I would think it, Representative Weber, you would know better than I, but I would think it could go on. If, depending on how the vote
Different
comes out.
speakers have had different rules, so I am loath to utter what might be a definitive opinion. My understanding in the past was that if it didn't have an actual appropriation, it didn't have to go on the consent calendar. And the other thing is this bill is going to go to finance, so it's not like it's the last word. But I don't care about the consent calendar if we could just vote on the bill and get on to the other 5 that we have.
Representative Tellez.
Thank you, Mr. Chairman. I just want to remind us that we had an incredible outpouring of people present, showing their commitment every single time we have touched this bill. And I think the principle underlying the need for it is, in addition to all the good points that have been made previously, is when we need to call 911 for ourselves or our mother, it doesn't matter who's paying the bill. If that emergency service provider does no longer exist because they went out of business, it doesn't matter if we have Gold Star health insurance of our own. Like, that will not be available. So this is a public good that we need to be able to assure continues to exist in this state, and I don't see why we're not all in agreement on that.
Representative Murphy.
Thank you, Mr. Chairman. And again, for fear that we would derail where we're heading for not a pass with an amendment. What I wondered about and what I thought about when I was watching, and you can't really scream through the camera that is in front of you all, but having said that, one of the questions I had, and I still have, is why the regulations for the repayment for that one patient that switched from Medicare or from Medicaid, was on Medicaid, why couldn't they have the same regulation as for reimbursement, that is, the same regulation that the Medicare patient has? So that's more of a question than it was, and I don't want to derail where we're going right now, but one of my questions was always, why do we have, why couldn't the same regulatory, mandates for Medicaid be the same as for Medicare, with just the fact that we accept a smaller reimbursement, which we know anyway? So that was more of a question than it was or a statement than it is a true question. So I don't want to derail where we're going, but again, that was always my question that I had from the get-go.
Thank you. Seeing no other hands up, no other questions, let's proceed to the vote. The motion is ought to pass as amended on Senate Bill 409 FN. I'll ask the clerk to call the roll.
Representative Leon,
Yes.
Representative Notter,
Yes.
clerk votes yes. Representative Kofal,
Yes.
Representative McLean,
Yes.
Representative Seth King,
No.
Representative Mazur,
Yes.
Representative Nagel, Representative Polozov,
No.
Representative Weber,
Yes.
Representative McKay. Yes. Representative Freitas,
Yes.
Representative Cannon,
Yes.
Representative Nutter Upham,
Yes.
Representative Shapiro,
Yes.
Representative Merchant,
Yes.
Representative Murphy,
Yes.
Representative Palmer,
Yes.
Representative Tellez,
Yes.
Representative McDonald,
Yes.
18-2.
Okay, is there any objection to consent?
No.
Seeing none. So we will put up that on the consent calendar then. All right, next up is Senate Bill 455 FN. Representative Nagel, did you have a motion? Okay. That was my question earlier. Representative Polozov, do you want to make a motion?
I move to interim study on Senate Bill
455 FN.
55 FN.
Do you have a second? I'll second. Representative Polazov, do you wish to speak to your motion? If not, I mean, that's fine. It's up to you.
Just this issue needs more study because there were some conflicting numbers during testimony. So while it's an important issue, I think we need to study it more.
Thank you. Representative Weber.
I'm going to vote against interim study because it seems to me that the policy, the underlying policy, is a good one. We want people to be reimbursed for services to people who need prosthetics. And this bill is a second committee bill. It's going to finance. And so the underlying policy, which is I want people to have the devices that they need to live their fullest lives, and I want the people who make those devices to be reimbursed to the best of our ability to do it, which is not going to be as much as they should be reimbursed in any case. So I hope that people will defeat the interim study so a motion of ought to pass may be made so that this can go on to finance and they can decide whether it's something that we can afford or not.
Representative Nagel.
Thank you, Mr. Chairman. This bill's really important to me. I've been involved in this discussion for a very long time, and the best thing that came out of that hearing was that the testimony was given by an independent organization. Beginning 30, 40 years ago, the concept of an independent vendor being able to do this was like, because of Medicaid payments, was like non-existent. That the fact that these guys even still existed just totally blew me away. What bothered me even more was the number of vendors we have in the state and how few they are. We're talking about a group of people that deal with a very traditional, historic Medicaid population as a large part of their payer base. These are the people with disabilities that are not going to be competitively employed. Many of them have cognitive disabilities in addition to their physical disabilities. So they're people that really rely on the state for survival. And with these braces, we can't ignore the orthotic part of it, because building an orthotic is an art form that I kind of think they trivialized during the discussion. But, you know, prosthetics and orthotics is really important, but it allows these people to function, to get into the community, to have a meaningful life. They are not getting the blades that, you know, the Olympians are getting, which is kind of sad in a way, but, you know, they're doing the best they can for these people. One of the things that bothers me a lot is, like, in a prosthetic development, like when you have an amputation, the way we did it when I started out, Murph, you may or may not remember this, but we did immediate post-op fitting so that the person woke up with a leg on their leg, and they, you know, there was a lot of reasons why he did it. They were both medical and psychological and social, but at the same point, there's no way in HE-double hockey sticks that, I decided to not swear, that you can do that on Medicaid, because it's a bundled payment and everything that you do costs you money in the end. So we're not providing the service that people need now. And this allows them to stay in business, to stay in function. And the last thing I will point out is that these guys, everybody needs an easy bill to get through really quick. Everybody needs an easy thing in work. This makes your job a little bit quicker for at least 10 minutes. These guys used to do a lot of off-the-shelf orthotic fits. Guess who took that from them? My group, other groups, things like that. Now we do the fitting, we get the money, and what we do is we delegate Medicaid to these guys. So they have to give the braces that don't generate any revenue because nobody else does it. And he said it right to us that if they're going to make a vote within the next year whether they're going to accept Medicaid anymore. And that's not good. That's bad. And I really think that it's important we support this bill. Thank you.
Other discussion, Representative Merchant.
Thank you, Mr. Chair. I definitely want to oppose the interim study. I believe there's a couple of things that I would focus my attention on. I will be focusing my attention on. One is that it's something that's desperately needed from a certain part of our population that itself is vulnerable to many things. But looking at it from a financial point of view from the state itself, the best way to get somebody off from Medicaid is for them to get back to work. And if you don't have the appropriate prosthetic devices to help the person become gainfully employed, they remain on the state coffers because that's the way they have to be, because they don't have the opportunity to become gainfully employed. So as a self-interest from the state itself, looking at strictly from a financial point of view, the more we can do to help people to get out of the Medicaid system and into full employment, I think it serves us all at the end appropriately.
Representative Murphy.
Thank you, Mr. Chairman. And in reference to Representative Nagel's question, we used to call it an IPOP because it was immediate post-operative, prosthesis that we would put on patients. But having said that, it was interesting because it was probably only within the last week they had one of the prosthetics and orthotics folks from New Hampshire, down the seacoast, I believe it was, that talked about this. There are only 5 in the state that do these prostheses in orthotic management. And they basically lose every time that they put one of these on for a patient with Medicaid. So they said, well, why would you charge anything anyway? Well, because something is better than nothing, and it offsets some of the costs that they have elsewhere in their business. So the long story short was that they did give examples of people that actually would be able to return to the workforce, were able to take care of themselves, were able to take care of their family if they were able to be mobile. So I would vote against the interim study and hope that a different motion would be proposed.
Representative Leon.
Thank you, Mr. Chairman. I actually wrote my college admission essay about making a prosthetic that could return a concert violinist to performing. So prosthetics, there's definitely something that I have a big interest in. One of the things that I did here was that sometimes the reimbursement is higher than that 90% of Medicaid, which is one of the reasons why I'm going to support the interim study. But if that fails, I'm also going to be supporting the bill, because I think that we don't want to cut short the ability to pay for it at a higher rate either. So, thank you.
Other discussion? Representative McLean.
Just clarification. I thought that this bill just moved it from 80% to 90%. So is that a real concern? So again, I'm just asking for clarification because it would obviously affect how I vote.
The original bill asked for 100%, and then it was amended down to 90%, but I don't personally think they get, I mean, the rule of thumb on Medicaid's 10 cents on the dollar.
Yeah. So my
Whereas
understanding
Medicare's
was
30 cents on the dollar.
my understanding was that it was at least 80%. This is my understanding, but I don't think the interim study motion is going to pass. But my understanding is that it's at least 80%. But this says equal to 90% of the reimbursement rate. That's my understanding of it.
A Medicare.
Way below what it actually.
Okay. Any other discussion or
Thank you.
any other questions? Seeing none, the motion is interim study on Senate Bill 455 FN. I'll ask the clerk to call the roll.
Representative Leon,
Yes.
Representative Nader,
Yes.
clerk votes no. Representative Kofalt,
Yes.
Representative McLean,
No.
Representative Seth King,
Yes.
Representative Mazur,
Yes.
Representative Nagel,
No.
Representative Polozov,
Yes.
Representative Weber,
No.
Representative McKay,
No.
Representative Freitas,
No.
Representative Cannon,
No.
Representative Nutter Upham,
No.
Representative Shapiro,
No.
Representative Merchant,
No.
Representative Murphy,
No.
Representative Palmer,
No.
Representative Tejas,
No.
and Representative McDonald.
Yes.
7-13.
It fails 7-13.
7-13.
Okay, motion fails for interim study. Is there another motion? Representative Nagel.
I ought to pass, please.
Second.
Representative Nagel moves ought to pass, and Representative Weber seconds. Do either of you wish to speak to your motion, or are we all set? Okay. Yeah, the motion is ought to pass. Any other discussion? Seeing none, the motion is ought to pass on Senate Bill 455 FN. When the clerk is ready, I'd ask him to call the roll.
Representative Leon,
Yes.
Representative Nader,
Yes.
clerk votes yes. Representative Kofalt,
No.
Representative McLean,
Yes.
Representative Seth King,
No.
Representative Mazur,
Yes.
Representative Nagel,
Yes.
Representative Polozov,
No.
Representative Weber,
Yes.
Representative McKay,
Yes.
Representative Freitas,
Yes.
Representative Cannon,
Yes.
Representative Nutter Upham,
Yes.
Representative Shapiro,
Yes.
Representative Merchant,
Yes.
Representative Murphy,
Yes.
Representative Palmer,
Yes.
Representative Tejas,
Yes.
and Representative McDonald,
Yes.
17-3.
Motion passes 17-3. Representative, do we need a minority report on something like that, or it doesn't matter?
If they want to write one, they have the option.
Representative Polozov, no minority report, okay. Thank you. 17-3.
Thank you.
Is it, Mr. Chairman, is it possible to go on consent even though it's 17-3 if there's no objections to it?
Is it,
I'm-
if there's no
I'm gonna
objection,
leave that up to a higher
does anyone,
power.
Let's try.
does anyone object to a consent? Okay, all right, we'll try. We'll put it on consent and see if it gets rejected. Okay, thank you. Next up is Senate Bill 456 FN. Do I have a motion? Relative to the state loan repayment program for qualified nursing professionals and making an appropriation therefore. Representative Shapiro.
I move ought to pass.
Representative Shapiro moves ought to pass. Is there a second? Representative Weber seconds. Representative Shapiro, do you want to speak to your motion?
Yes, I think this bill, as it was explained during the hearing, is a very moderate expansion of the SLRP program, the Student Loan Repayment Program for medical providers. And it just adds $300,000 specifically for nurses with high student loans. So it really, I mean, it's money. It's $300,000, but in my mind, that's a pretty moderate expansion of a program that's meant to enhance workforce, specifically in an area that has become particularly problematic, which is nurses, which, and we've talked a lot about how there are so many nursing agency nurses that are providing care in a variety of places, especially nursing homes, which just ups the cost for our county nursing homes and other nursing homes. So I think this is an effort to remedy that by helping students with large student loans.
Thank you. Other discussion? Representative Murphy.
Thank you, Mr. Chairman. And one of the things I came to realize was that it's not just the community hospitals, it's at the major medical centers that nearly 80% right now, nearly 80% of the nurse force at DH right now is travelers. That's a very expensive ticket to pay for, on a regular basis. And so what I'm saying is that what we've also realized too in training programs is that if somebody moves here and stays here and starts to work here, they will stay here. So I think it will help the nursing homes, the community hospitals, but also the tertiary and quaternary care medical centers. Thank you.
Thank you. Representative Leon.
Thank you, Mr. Chairman. Just looking from my economic background and working with companies that sought financial opportunities and then moved as a temporary benefit left, I appreciate the goal of trying to do this, but I'm not sure that somebody who's moving for a temporary financial benefit won't then move for another temporary financial benefit. Quite frankly, when you look at the economic incentives, it makes sense for a New Hampshire nurse to be a travel nurse elsewhere and people from other states to come here. So my concern is just continuing to further muddy the waters with additional money here, money there. And just as a policy wise, I don't think that, I think that we're just compounding the problem more and more. So while I appreciate the burden of this debt, I appreciate how challenging it is to be here. I just don't think that it's the right solution.
Other discussion? Representative Kofalt, then Representative Merchant.
Thank you, Mr. Chairman. So I guess, my concern is, although it is a limited amount of money, it is nevertheless consuming taxpayer dollars. I think we've seen similar concerns on a national level when we have taxpayers at large, often including people who never had an opportunity to avail themselves of higher education, could not afford higher education, subsidizing the higher education of those who could. I don't think that's right. I think what we're doing is we're trying to tinker with a problem that is driven by the fundamental economics. If the economics are broken, I think trying to insert a Band-Aid into that situation that really doesn't fix the problem on any scale is the wrong approach. So I'm going to be voting against this OTP motion.
Representative Merchant.
Thank you, Mr. Chair. I concur with Representative Kofalt in the sense that the economic supply and demand. However, I also look at it from another side, and that is particularly in county nursing homes that we subsidize heavily from the state coffers, that if they're having to pay more for traveling nurses, ultimately we're paying for it anyways. So at this point in time, it's an opportunity for us because there's a report required to find out how well this program actually worked. It's more of a pilot to begin to understand, in fact, by doing an incentive to people to come to the state of New Hampshire to work here, does it in fact help us with the economics? Because if we don't find a way to reduce the labor cost, in particularly nursing homes, we ultimately pay the price. And when I say we, I'm talking about the state coffers itself. It's coming out of our state budget. So one way or the other, either we're going to pay for it because it's coming out of the request from the counties to the state itself for more dollars to support their deficits, or we find a way to reduce the burden because the labor pool becomes greater to drive the labor costs down. So I'll look at it particularly from that point of view.
Thank you. Representative Shapiro.
Thank you, Mr. Chairman. I think we all are guilty of using hyperbole, once in a while to prove our point. But so it would be crazy for me to say that this is going to solve the workforce problem with nurses. I think we could all agree that this is, if anything, it will barely make a dent. But I personally was moved by talking to Christine Stoddard, who represents the qualified health centers, and the degree to which they take advantage of the student loan repayment program that the state runs to keep people in jobs that are probably not the most high-paying nursing jobs. And so I just think we should do our part to add to that effort. It's not going to bring all the nurses running to New Hampshire.
Other, yes, Representative Tellez.
Thank you, Mr. Chairman. I think, without arguing about how economics actually plays out in real life, I think this is needed. It's needed by the employers. State loan repayment is a very proven strategy that's used all over the country to put providers of healthcare in places where it's needed. So similar to the ambulance bill we just discussed, there are places, rural New Hampshire, other places that are high need, so people of low economic means can have access to health care. Access to health care then helps you access better education and better employment opportunities. So thinking about this investment, which is very modest and which is being requested because of the need that's already been established and proven, makes a lot of sense.
Thank you. Other discussion, Representative Leon and then Representative McLean.
Thank you, Mr. Chairman. Economics isn't just something that's thought about in ivory towers. It's something that impacts our lives day to day. And especially as state legislators, we need to understand how to best allocate our limited resources. Many of us supported the ambulance bill because it is absolutely crucial to make sure that our first responders are paid for providing these vital services that we require them to do and that, quite frankly, we count on them to do. This bill, it may or may not attract people. We've said that it probably won't make much of a difference. We are looking at revenues that are going down from the state because it looks like the market, I feel like I'm on a roller coaster. I'm starting to look. It looks like the economy is probably heading back down again. I know that some people will say that's a reason for more subsidies, but the other question is, where do we bring the money from? Do we want to then defund these payments that we're having for these non-transport calls? Is there something else that we're not going to pay for in exchange for the student loan repayment for nurses? We're to be stewards. I recognize that we're not the finance committee, but giving an idea of which policy we think is going to have a greater impact to Granite Staters matters too. I know that I believe that the ambulance bill has a far greater impact to Granite Staters than something that will be a nice to have that may keep a few more nurses in practice, but that isn't going to move the needle as significantly. And that's why if we're not going to have people coming here for this, if it's something that even if they do come, it's because they're chasing the largest opportunity. And I'm an economist. I'm a market person. I don't have a problem with chasing opportunity. And my idea is that hopefully people will find their way here and just like me say, wow, I finally found home. And my hope is that we'll have people that come here and say, wow, I finally found home. But I'm not certain that loan repayment is going to be that segment. The more that we respect and honor the people and make sure that their autonomy, personal autonomy as healthcare providers is respected, the better as well. So I recognize why many people on here think that it's important, but I think that we're better off putting that money towards reimbursement for non-transport than for this that doesn't seem like it'll help, and it may provide some incorrect influences.
Representative McLean and then Representative Palmer.
Yeah, thank you, Mr. Chair. I mean, I support the intention of this bill, but as was alluded to earlier, realistically, it's not going to do anything. And with money in limited supply, why would we give it if we don't think it's going to achieve the desired intention? The fact of the matter is, there is such a huge dollar difference between what the traveler is paid and what the regular person is paid. That is what you're going to have to look at, and that's what you're going to have to do with respect to your pay structure. And that's a much harder decision and much more difficult solution for hospitals to drive towards. And I have a lot of sympathy for that in an area of rising healthcare costs. But that's what it's going to take. Somebody alluded to discussions at the county level. We talked about the same thing at Hillsborough County for retention bonuses for the deputies with the county sheriff. It was a $3,000 retention bonus. But the Manchester police are poaching them, and they're giving them $30,000 more. And so my heart says, yeah, but is it going to achieve the desired effect? And with money being what it is, we need to have people looking at the real solutions, not the feel-good solutions, in my opinion. So I support the intent, but I can't support the bill.
Representative Palmer and then Representative Shapiro.
So I guess I'm thinking this is a short-term fix, and we're talking about the long-term fix. The short-term problem is, so there was a nurse yesterday at work, and she took a job at the hospital I work at in Vermont because Vermont has a pretty good loan reimbursement program as opposed to in New Hampshire. Good for us, but the short-term problem is that we still have empty beds that we can't fill because we don't have nurses. I can't send really sick patients to Dartmouth because they don't have nurses. And so short term, we need to sort of, my opinion on this is that we need to sort of take any little bit we can get to fill in, plug a few holes. The long term solutions are being looked at. The Primary Care Commission has got really nice data to show that if we train more nurses in New Hampshire, they stay here. And that's the good long-term solution. And the same thing is being applied to physicians with new residency programs in New Hampshire. So I don't think this is a great solution, but short-term, we need to do something because we're really struggling to take care of patients.
Representative Shapiro.
Yes, maybe we've talked this one through, see a few shaking heads, but I guess my thought is that when people say this is just a Band-Aid, that's code for this is not useful. But when you need a Band-Aid, you need a Band-Aid, and I think this is a Band-Aid, but I think it's sometimes very useful to have a Band-Aid. And we probably have different underlying philosophical philosophies about these kind of things that will dictate our vote, but I'm going to vote for it because I think it's a useful Band-Aid.
Representative Nagel.
Thank you, Mr. Chairman. I would define this as more of an orthotic than a Band-Aid, but anyways. Keep it pertinent. It's really weird when we're going through all these bills. I'm looking at, this is a good idea, this is a good idea, this is a good idea. Who's going to pay for it? Who's going to pay for it? Who's going to pay for it? So I had a conversation with somebody way smarter than me, and he told me it's not your decision to make who's paying for it, it's to decide whether the idea is value. I agree with everything that Dr. Palmer said. Continuity is unbelievably important in healthcare, and we don't have it, and travelers do not provide continuity. They're here today, gone tomorrow, and there's a lot of people that we've seen, nurses or whatever that, with things like this will choose to stay, and that's important. And if you have a nursing home like the County Home or wherever, your goal is just to have at least a percentage of people that stay. And this does help. And a lot of these entities actually do subsidize education now on their own. If I had to tell the finance department and prioritize this relative to some of the other things we've talked about, this would not be number one on my list. With that said, that's their decision, not mine. And that's why I'm going to support it.
Representative Seth King.
Thank you, Mr. Chair. One thing that seems absent from this conversation is where did all the nurses go? Because, just a few years ago, we didn't have this sort of really bad nurse deficit. And then something happened, and all of a sudden we had a huge labor pool of nurses leaving, including my wife, as a matter of fact. The nursing environment became extremely hostile for like half of the nurses. And they just disappeared. So you might want to think about that. If you don't know what I'm talking about, I'll tell you right now that in order to even, I was looking at it a few years ago, I don't know if it's still the case, but if in order to even start the path of becoming a new nurse to go to school, they were mandating COVID vaccines just to go to school. So not only have we alienated a huge portion of nurses from the workforce, we've also alienated half of this country who would otherwise think about becoming nurses, saying, I'm not going to take that stupid vaccine just so I could go to school to become a nurse, and they're going to go do something else. So if you want to really alleviate the problem, get rid of the thing that's causing the problem. Don't just add little Band-Aids to the situation. Thank you.
Representative Nadarappa.
I was just wondering if we could move along to the vote.
Okay. Is there anything new that anyone has? Representative Tejas?
I just want to add that there's a lot of complexity to why there's a nursing shortage, in addition to a fifth of the workforce leaving as a result of the pandemic and related feelings and attitudes. It's longstanding, and that's why the Legislative Commission on the Interdisciplinary Primary Care Workforce exists, and a whole other set of people working on addressing these workforce issues that relate to supply. So that's why these strategies of loan repayment, which have been proven to be effective and which the employers are requesting, are immediately helpful.
Representative Leon.
Thank you, Mr. Chairman, and thank you, Representative Seth King, for bringing up one of the big issues that we have here. Other states successfully pushed back and allowed their healthcare providers that wanted to continue to care for patients to do so with other precautions.
Mr. Chairman, I am going to object to refighting the COVID and masking wars in a context of a bill that you may be for or you may be against, but which does not have anything to do with that. So given that we have four
Point of
bills
order.
to finish, I
Point
am
of
going
order.
to ask that that
Let
be
him finish.
ruled out of order.
Representative Leon?
Point of order. If somebody is to interrupt, aren't they supposed to ask for a point of order and then be recognized by the chair instead of just speaking?
My apologies, I should have done that.
This is, and if I may continue, this is a causal factor. This is a causal factor where we had multiple healthcare providers leaving. We had people who were not going to nursing school. If we think $300,000 in loan repayment is going to solve the problem, we are looking in the wrong place. I have seen certifications thanking respite homes, places of last resort care, thanking them for having a vaccination rate of 75%. Yet we had a zero tolerance policy in this state, and we are suffering for it. We have beds that are not filled because of that. We can't just sweep this under the rug because this has caused harm. It's caused far more harm by requiring this and pushing people out of the workforce than a vaccine that did not show to
Point
reduce.
of order, Mr. Chairman.
Point of order, yes.
Would you rule on my prior point of order, no matter how inartfully stated?
I think this discussion, I think we've gone past the debate that's relevant for this bill. And at this point, I think we're getting into other issues. So let's just move on. I think everybody knows where everybody stands on COVID, masks, and I'm not going to get into the merits or the demerits of any aspects of the arguments, but Representative Leon, I respect what you're saying and I understand your points. But clearly, at this point, the mood of the room is that we need to move on, and why don't we do so? I'm going to ask the clerk to call the roll. The motion is ought to pass on Senate Bill 456 FN.
Representative Leon,
No.
Representative Nader,
No.
clerk votes no. Representative Kofalt,
No.
Representative McLean,
No.
Representative Seth King,
No.
Representative Mazur,
No.
Representative Nagel, Representative Polozov,
No.
Representative Weber,
Yes.
Representative McKay,
Yes.
Representative Freitas,
Yes.
Representative Cannon,
Yes.
Representative Nutter Upham, Representative Shapiro,
Yes.
Representative Merchant,
Yes.
Representative Murphy,
Yes.
Representative Palmer,
Yes.
Representative Tejas,
Yes.
and Representative McDonald.
No.
11 to 9. Motion passes.
Okay. All right, I assume there'll be a minority report?
Representative Shapiro made the motion.
Representative Leon?
Yes, we'll figure that out.
Okay, there will be a minority report.
I'm gonna write it.
Oh, okay. Bill King has agreed to write Representative King has agreed to write the minority report. Okay.
So am I writing the report?
You're writing yes, you're writing the motion of the report on OTP. All right, next up is Senate Bill 495 FN, and Representative Weber, you have an amendment, I believe?
I do have amendment 1592H, which I will pass out, and then I would just be glad to have leave to speak to it briefly.
Sure.
Which one? 496, 495. Yes.
Okay, Representative Weber, do you want to make a motion?
I would move the adoption of 2024-1592H.
Second.
Who seconded that?
Representative Cannon.
Representative Cannon, I'm sorry. Thank you. Would you like to speak to your motion?
Yes, please. Thank you, Mr. Chairman. What this does, there were a number of issues identified with the bill. This addresses some of them. I think we heard loud and clear the need for some kind of regulation. And the concern that I had personally was the definitions were a little circular. But in fact, the initial stuff that I objected to in the first part is existing language. So I don't want to mess with that because I don't want to mess up what we may already be doing in other contexts. So this looks at section Roman 2, which is the added language, and there were several objections there, one of which was we weren't terribly sure what we were talking about. Secondly, the residential treatment was included, and we were told that residential treatment was not included. So what the amendment makes clear is that it does not apply to residential treatment. So that, because that was taken out. And the other thing that was omitted was the language about shall include but not be limited to. So the door is not fully open. The door is limited to these items, which are, as far as I know, set out by the American Society for Addictive Medicine. So in that respect, I think it makes it clearer as to what we're talking about. And that's where we're at.
Other discussion on the amendment? Representative Seth King.
Thank you, Mr. Chair. Apologies for my confusion on this. I'm just not sure what's being changed in the original bill. It says amend RSA 172, but then in the original bill it says amend RSA 126A. And can you just fill me in on what part's being changed here? I don't.
Well, the bill is exactly as it was in the original. If you look at the original bill, the only thing that this is changing in the amendment is the definitional section under 2, which is the part that relates to the state substance use of disorder services system, but that is already existing language. If you see in the original bill as we received it, that is not in bold, that is in statute now. So that already exists. This is an addition to existing statute, and so all it's doing is changing the added definitional section.
I'm sorry. I'm looking at amendment to SB 495 FN. I think I screwed up because we're on Bill 496 now, right? What are we doing?
No,
No, we're on 495.
We're on my apologies.
It's line 26.
Yeah.
It's past my lunchtime.
Okay.
We've certainly done a lot to burn up our energy this morning. But, Representative McLean.
Thank you, Mr. Chair. And I guess I have a question for some of the folks in the committee. In the week since we had the public hearing, I mean, I was very confused, probably had a lot of circular questioning, which probably confused everybody even more, but I think I kind of understand it now. I did communicate, with the folks at Manchester, where obviously we have a real problem, and substance abuse treatment in an unregulated manner in the city is a real problem. Speaking with the mayor last night, he said, look, this is the reality. The reality is you spend 90 days in Valley Street Jail, you come out, you're clean, you go in to get your treatment, and you're being treated by someone who's been sober for 30 days, and everything kind of goes off the rails. So I agree, and I 1,000% support the intent and the need of this, and I communicated that to the mayor. My concern was, from what I was able to gather out of the testimony last week, there was some real concerns with respect to the breadth. So not knowing a lot about it to the extent of some of the other folks, those folks that had objections about, does this eat into AA? Does this eat into the single shingle person? Does the amendment, going in and eliminating that language, that says, hey, this is but not limited to, is that adequate to address those concerns, or do we need to interim study that? So I guess I'm just throwing that question out there to those folks who had those concerns to maybe give some feedback to let me know where they're at this point. Thank you, Mr. Chair.
Representative Leon.
Thank you, Mr. Chairman, and thank you, Representative Weber, for bringing this amendment. I think that you've clarified quite a few things, but I think I have even more questions now. I don't know what the outpatient services set by the American Society of Addiction Medicine are. I don't know what that includes, and I don't know what that's going to impact. I think that this is a highly complex issue, and it's one where, when it was brought forth, it seems like some of the issues that this was designed to solve were actually happening in residential facilities where they should already be licensed. So I think that while it would be great to be able to do something right now, this amendment helps, but I really think that we need to truly take a look at this and truly work on this as an interim study so that we can figure out what the right approach is. Because you're right, fly-by-night recovery clinics are not the right way to go about it, but how do we know that this process is going to fix it? And when you look at the entire context of it too, with the rulemaking process, this is going to take time in order to figure out how to get it done and how to do it correctly. And because of that time frame, because of that need, because we're trying to figure out all these balances, I don't want to rush into something that's not going to be the right solution, and then we're trying to figure it out, and then we need to come in and change it next year, as opposed to us spending the time to meet with those who are addressed and impacted, talk and see if AA would fall underneath this, see if other peer recovery would fall underneath it, and just ensure that we're not making things worse in the process of trying to make things better. Because quite frankly, some of those big headline grabbers should have been covered, and we're not doing anything to make sure that there's a lot of different things we could look to. I mean, when you look at sexual assault, a provider has certain restrictions, and things that could be done from an adult to an adult are not acceptable if there's a provider. If somebody is not free to go in a prison or another situation, anybody who has that control and power cannot have a sexual relationship with somebody because of that imbalance of power. We have nothing like that for sober homes or people who run them. So, and this is a significant issue actually in recovery. I know people who have relapsed because whether it was somebody who was in the program and providing oversight, or even just another person in recovery, once you become a linked pair, it's hard enough for one person to get out of addiction. Then having a pair becomes more challenging when you have a new partner. Your whole identity as a couple is recovery, and then one person hits a stumble, it can pull the other one back in quite tightly. Obviously, we can't deal with the peer issues, but the fact that we have nothing to address that imbalance of power with people who are in recovery systems, that's a significant issue, and one of the things that this bill seems to have addressed. So I think that this will make us feel good, but I'm not sure that it's actually going to solve anything, since the problems happen at already licensed facilities.
Other discussion? Representative Shapiro.
This certainly doesn't answer all those questions, but in regard to an independent practitioner, if you look at the amendment, line 10, it explicitly says that independent providers are exempt from this certification. So it would not, the language says that it would not include a sole proprietorship, private practice type situation. And I mean, I guess definitions can always be stretched, but it certainly seems clear enough to me that there are very specific things that are included in this amendment, and they do not include AA or anything that sounds like that kind of volunteer self-help kind of group. So anyway, I just wanted to respond to the thing about private practitioners. They are explicitly excluded from this.
Representative Kofal.
Thank you, Mr. Chairman. So I think in the hearing and in this discussion, I've heard statements that we all agree there's a problem. I respectfully do not agree that there is a demonstrated problem. I find it very interesting that in the hearing, one of the cases that was cited multiple times as a justification for why we need this pertained to licensed healthcare facilities, something that occurred in licensed healthcare facilities. I do remain concerned about what happens with some of these, faith-based programs, AA, things like that. I think my big concern about this is that it is creating broad, sweeping regulatory powers where I don't think that we have substantiated a need for it. If we were to go interim study with this bill, I think that would provide an opportunity to look at it in more detail, to understand if there's a need. But, the response that I kept hearing was, well, that's exactly why we need regulation, is because we don't have visibility. Okay, well, you either have visibility and there's a problem, or you don't have visibility and you need visibility. I think that we would be well served by speaking to a broader spectrum of constituents and not just the 3 or 4 people who showed up at the hearing to speak in support of the bill.
Representative Weber?
I was just going to say that in light of the confusion that people had originally, which I will be the first to concede that this does not completely resolve, I wonder if, rather than arguing back and forth over this, it would be helpful if we were to take a straw poll on how many people were interested in an interim study. Because if that's the sense of the committee, I don't want to take up the committee's time trying to explain something that came to me from people I trust, but which I have an imperfect understanding of. So I just offer that as a possible way forward.
Thank you. That's something we may ask when the chair gets back from his phone call. I did look up outpatient treatment with the American Society of Addiction Medicine. So the level 1 treatment, I'm going to read the description and then let's see if people want to see what that fits into. It's services that assist an individual or group of individuals to achieve treatment objectives through the exploration of substance use disorders and their ramifications, including an examination of attitudes and feelings and consideration of alternative solutions and decision-making with regard to alcohol and other drug-related problems. So this is me just working on the fly to understand this. To me, I've never been to AA, but I have read the book. And to me, it seems similar to that. I don't know if I'm not asking anybody to say that they have the experience, but it seems a little close to me. Representative Nagel?
This is my concern, and this goes back to that whole harm reduction thing. We relied on, ASM for, our definitions, but we looked at what they said and we wrote them down very specifically rather than making a reference to it. And I don't personally think you should have to go to some other source to figure out what you're talking about. I think if you're going to say that, you need to say what it is you're saying. That's my opinion.
Thank you. Representative Merchant?
Thank you, Mr. Chair. And also want to thank Representative Weber for working on the amendment. Again, maybe I'm trying to get too far into the weeds here, but on line 4 of the amendment, it talks about a certification process, not a certification. So what I'm trying to wrestle with in that, are we talking about how they become certified or what the requirements are for them to become certified? So what I'm trying to understand is that, I go back to, as I mentioned before, is that it's the individuals in a program that cause the abuse, not the program itself, nor the facility. So I want to be sure that somehow in the certification process, whatever we're talking about, the program, how it's going to be developed and what the requirements are within that program, because I really concern myself with professionals. And I'll go back and say something quickly on the issue of regulatory overload, there's many times in which 95% of people want to do the right thing and 5% of the people who don't. And the 95% of people who are doing the right thing are burdened by the regulatory environment because they're going to do it anyways. And the 5% who don't want to deal with the regulatory issues probably going to ignore the regulations anyways. So I want to be careful that we don't somehow take the ones that are doing the best to be doing the right thing, that we don't create more burden on them to try to protect the people from the 5%. So that's what I'm trying to get to.
Representative Weber.
So this bill was presented to us as a way to allow the department to start writing the rules that would answer the questions about what the process was and things like background checks and other things that have been suggested ought to be in there. That said, I do concur with the idea that it's always better to have the actual standards in rather than a reference to something else. Mr. Chairman, when you were out of the room, I said that I asked that it seems like it might be helpful, given the questions that everybody has and what I'm hearing from members of the committee who've spoken, if we took a straw poll on interim study rather than proceeding immediately to try and parse this out, because that might make things clearer. And then again, it might not. That was my offer of a suggestion that might help if it doesn't, or if people don't want to do that. I'm more than happy to proceed as we've gone on.
I think it's a good suggestion. Any objections to a straw poll? On interim study? All right, how is that usually done? By a show of hands or?
Yeah.
Yeah. Okay, all those who would be favorable to interim study as opposed to something else? All those opposed? Okay. Apparently most of the committee favors interim study.
I would be willing to withdraw my motion if the seconder, who I've now forgotten who it was, is also willing to.
Okay. And thank you for your efforts in bringing this forward, and Mr. Barry, thank you for your efforts also. We knew it was a complex issue from last week's hearing, and we knew it was going to be a heavy lift to try to get it through in such a compressed time frame, and at least an effort was made. And I'm sorry it didn't. Well, we don't know what's going to happen, but it looks like it's going to be interim study. So, anyway, do I have a motion for interim study at this point? Representative McLean.
Yes, Mr. Chair, I'd make a motion for interim study on SB 495.
Okay. Representative McKay seconds? Okay, thank you. Okay, a motion is interim study on SB 495 FN. Is there any discussion on the motion? Representative Polazov.
I just want to state and double on what Representative Kofod said, that why I agree with intent of solving problem, I don't agree with presumptions in the bill that more regulation will solve the problem.
Okay, thank you. Any other? Yes, Representative Weber.
I just wanted to say thank you very much for allowing me to present the amendment, because
Absolutely.
I'm glad to have it considered.
Well, absolutely, and again, as I said earlier, I want all departments to feel that we try to consider all aspects of every bill that relates to them. Representative McKay.
I was going to say thank you, Mr. Speaker.
Don't say that. I don't want to be speaker.
I don't think you want that. I wanted to thank Representative Weber for what she did. This is a very valuable part that we can use in interim study. I wore myself out the other day. Unusual for me. This type of subject is extremely important to me, and I think to everybody else. It's a very complex subject, and I think interim study opens it up for us to get at the complexity of the subject. I don't know how many years I've been here, but it's all been for mental health issues. And we've got massive information in the department, including the 10-year plans that go back years and years. So that I think the department was concerned with where we were at this point with this legislation. I think they're reassured that if we go to interim study, we're going to come up with legislation that deals with a very important part of our population that is often misunderstood. And I go back to the point where New Hampshire Hospital was a terrible place. I've never criticized them because they did the best they could until Thorazine came along. There is much more that we can do now based on what we know. And it's that I would like to see that the state takes responsibility for, and that's my purpose for supporting interim study, to use the information we already have and to strengthen what is now a very good program. Thank you, Mr. Speaker.
Mr. Chairman, thank you. All right, any other discussion on the motion of interim study? Representative McLean.
Yeah, I just want to say, I mean, Manchester is ground zero when it comes to, issues with substance abuse. And talking to the people on the ground there, this is a real issue. And so I do appreciate, Representative Weber, you bringing forth the amendment, because it certainly clarified and distilled a lot of stuff in my mind. But I do want to make sure that we get it right. And I do think that this is such an important issue that if we do bring it to interim study, we are going to get lots of input from lots of different stakeholders. And I think it's going to be very valuable. And that's all I have to say.
Any other discussion? Seeing none, I'll ask the clerk to call the roll. The motion is interim study on Senate Bill 495 FN.
Representative Leon,
Yes.
Representative Notter,
Yes.
clerk votes yes. Representative Kofalt,
Yes.
Representative McLean,
Yes.
Representative Seth King,
Yes.
Representative Mazur,
Yes.
Representative Nagel, Representative Polozov,
Yes.
Representative Weber,
Yes.
Representative McKay,
Yes.
Representative Freitas,
Yes.
Representative Cannon,
Yes.
Representative Nutter Upham, Representative Shapiro,
Yes.
Representative Merchant,
Yes.
Representative Murphy,
Yes.
Representative Palmer,
Yes.
Representative Tejas,
Yes.
and Representative McDonald.
Yes.
19-1, it passes.
Is there objection to consent? No. Thank you. Okay, next up is Senate Bill 496 FN. Representative Bill King, did you have a motion?
Yes. I'd like to move to ITL, inexpedient to legislate.
Okay, motion's been made, inexpedient to legislate. Is there a second? Representative Kofalt. Okay, sorry.
I'll second it. That's fine.
Okay, we get 2 seconds. Representative Bill King, do you want to speak to your motion?
Yes, I want to start by saying that I am a believer in climate change and environmental impacts that are happening from the climate change. So my objection to this bill has nothing to do with that. I will also note that climate change has been happening ever since Noah's flood, but it has definitely increased in recent years. The objection I have to this bill is that I think that it's going to overtax DHHS. They're already involved in a lot of different things within the state. And actually, somebody who came to speak for the bill actually convinced me not to vote for the bill. And it was somebody who had a not-for-profit and is doing a very, very good job coming up with solutions. And so I think a lot of times we agree on the premise of a bill, and we've heard a lot of that this morning already. And yet we don't agree on the solution. So I think the solution is to actually have not-for-profits look at this rather than having state and government look into trying to come up with a solution for us. And that's why I would like to ITL this bill.
Okay, other discussion, Representative Merchant and then Representative Shapiro.
Thank you, Mr. Chair. Also, I concur with what Representative Bill King said. I looked at the bill. There's no funding mechanism in this bill. And given the fact that the Department of Health and Human Services being on the Oversight Committee, it does a gallant effort to accomplish what we ask it to accomplish. To ask them to do more things with no funds, it's almost like an unfunded mandate to the department. I think it's unfair to the department. I think at this point in time, I do believe in the bill. I just oppose it because there's no funding mechanism for the department to have the resources to accomplish exactly what we're asking it to accomplish. I know it says they can have grants and so forth out there. The department could do that on its own without legislative authority. I just, for those reasons, don't want to support the bill. I'll support the motion to ITL.
Other discussion, Representative Shapiro.
Yes, I'm going to vote against ITL. At the same time, I understand some of the reasoning that ITL is being considered first. I think seems accurate to me that the Department of Health and Human Services could already do this without legislation. In fact, I think we heard testimony that they are doing this in many respects. They talked about tick-borne illnesses and keeping data on certain health outcomes that might be related to climate. For myself personally, I just feel like we are the Health and Human Services Committee. And we should send a strong message that we think that climate should be taken into consideration in terms of the future health of our state. And unfortunately, unlike Representative King, there are a lot of people who absolutely do not believe this is an issue. So I think as the subject matter committee, this is an opportunity for at least me to take a stand and send a message that this is important and should be looked at as much as possible.
Representative Weber and then Representative Kofalt.
Thank you, Mr. Chairman. I share in an awful lot of what was said by the two previous speakers. Here's the way I come out on it. As I read this bill, it doesn't have a lot of substance. And it certainly doesn't have any funding. It does have a direction to look for grants, and it is a position that did exist at one point. I am going to vote against the ITL because I want to affirm the policy in here, but it's a close call for me. I wish there was more substance here. I would be fighting a lot harder if there was more substance rather than less. But I think it's a measure that doesn't hurt. And therefore, I'm going to vote against the ITL because I am for supporting the underlying policy.
Representative Kofalt.
Thank you, Mr. Chairman. So I guess there were a couple of examples that were brought up when we asked sort of what would this position do, what would it focus on? And the three that I recall related to warning people or informing people regarding tick-borne illnesses. The second one had to do with wildfires in Canada and the smoke that was drifting down into New England. And the third had to do with educating people about heat-related injuries like heat stroke. I don't understand why we need a separate position to do any of those things. I don't understand why any of those things would be outside of the purview of the department currently. It seems to me that by authorizing this position, or even with or without funding, we are essentially creating a hole that the next legislature is going to need to fill with funding. So I think that for me, the debate is not how any of us necessarily feels about climate change per se. The debate is this necessary? Is it effective? Does it really do anything? And as far as I can tell, there's nothing that this bill would enable that is not already possible as an activity per se. I'm not speaking of to a position, but there's nothing that this bill says we should do that we can't currently do in the department.
The discussion. Representative Palazzo.
Thank you, Mr. Chair. I don't agree on premises of this bill, and specifically on future actions and legislations that this legislation would enable, because those policies can and will backfire. For example, we have problems with ticks, but if green policies allow more forest and higher deer population brings more ticks. We do have a risk in New Hampshire from future hurricanes, but if we allow more trees that will eventually fall on houses, it will backfire. If we put our emergency services on electrical vehicles and states around us threaten our energy supply by enabling green energy policies, we will end up with emergency vehicles not able to serve us. So I'm afraid about consequences of such legislation.
Okay, any other discussion? Representative Leon.
Thank you, Mr. Chairman. My questions arise on the fact that this can be done through the Department of Health and Human Services, and then how much validity this would give to a national climate emergency that may be declared by the White House, and whether or not the commissioner needs to take actions for that national climate emergency under the more broad-reaching authority of the commissioner of the Department of Health and Human Services relative to other commissioners and other people in the executive branch other than the governor. We have to look at whether we're trying to look at first and second order causes or third and fourth order causes. We have our issues with tick-borne diseases, and regardless about what causation we have, we know that Lyme disease is an issue. We know that some of these other that may make my life miserable if I become allergic to meat end up moving here into New Hampshire. I think that trying to get into those second, third, fourth order causes just really dilutes the effort, because we task the Department of Health and Human Services with doing so many different things. This is something where we have experts all over that are collecting data. We have guidelines that are coming from other areas. The idea of trying to collect and analyze data, we have on another bill, collecting and analyzing data relative to cannabis legalization. That one's costing $200,000 a year, because we have some of the collection costs, and then we have a salary cost that's over $100,000. If we're not going to fund this, then we get into other challenges. And the more unfunded positions we have, the more challenges we run into, because we ask the department to do something and then we don't give them the resources. I know that I personally apologized after working to pass a bill last term that we should have funded. And we had to come back through this entire process with 1669 to make sure that we had the funds necessary for the department to do their job. So the idea of doing this and moving forward on this, I just don't think is a good use of state resources when we have so many other areas that are more pressing need, that are more directly related to the efforts here in the state. You know, everything else we're doing to address health will already address these areas which are trending and becoming more prevalent. And I just want to keep us mission focused on health, and, perhaps let environment and ag or resources, whoever deals with more of the climate change issues, worry about that, because regardless of what's changing, the prevalence of different diseases, we focus on the health. We have other committees that deal with more of the climate change issues.
Other discussion? Okay, I'm seeing none. Before I put the question to the committee, I don't know exactly where this is going to end up, but four of us are due in ED&A on another bill in 15 minutes. And in the event that we go to a second vote on this, it's going to be calling it a little tight. So before I put the question, I'm thinking that perhaps Representative Murphy, you and I, and Representative Tellez and Representative Nagel should go on to the ED&A on another bill. It's Senate Bill 440. At one point we thought it might come to this committee. It's only going to them, but I don't want to be late for that. So I'm just thinking, in the event this goes to a second vote and it gets to be a split vote, it might be safer to. As Representative McGuire, I hear, runs a pretty tight ship. Representative Burchett.
Can we do a straw poll?
Sure.
Couldn't we just take the first vote and then we'll know where we are? It will take
Okay.
us 3 minutes.
Oh, okay, and then we don't have to, the people for the first vote wouldn't have to stick around for the second vote, you're saying?
Everybody can go en masse if they need to, yeah.
Okay, all right, in that case, Representative Bill King has made a motion of ITL on Senate Bill 496 FN, and I'll ask him to call the roll.
Representative Leon,
Yes.
Representative Notter,
Yes.
clerk votes yes. Representative Kofal,
Yes.
Representative McLean,
Yes.
Representative Seth King,
Yes.
Representative Mazur,
Yes.
Representative Nagel, Representative Polosov,
Yes.
Representative Weber,
No.
Representative McKay,
No.
Representative Freitas,
No.
Representative Cannon,
Yes.
Representative Nutter Upham, Representative Shapiro,
No.
Representative Merchant,
No. Yes, sorry, yes, sorry. I support the ITL.
double negatives. Representative Murphy,
No,
no.
no.
Representative Palmer,
No.
Representative Tellez,
No.
and Representative McDonald,
Yes.
12-8.
Representative Weber, you were right, as you often are. Okay. I assume there'll be a minority report?
We'll discuss among ourselves, but we understand you need it this afternoon.
Okay, great, thank you very much.
And I would just, with the last one, I abjure my colleagues that when you have the votes, stop talking. And Representative Leon, when I said that the first time, said, and when you don't have the votes, stop talking. So I should have probably said that earlier.
Okay. Let's make a note. Okay, so I'll just make a note, there will be a minority report on that. Okay, and with that, the next bill could go on a bit. I know that's a little bit of a contentious issue on those pills, those contraception pills. So I think it would be a good time for the four of us to go on to ED&A. Again, it's 2 Republicans and 2 Democrats. So if you folks want to join me, and I'll leave the gavel with the Vice Chairman. Thank you, Madam Vice Chairman.
Thank you. And with that, I will open the executive session on Senate Bill 567. And Representative Mazur, do you have a motion?
Yes, thank you, Madam Chair. I'd like to motion to ITL
And I'll second
On-
that. Sorry.
on SB 567 FN.
Okay, and I'll second that. Would you like to speak to your motion?
Yes, it's just confusing and honestly concerning why we're singling out just these two drugs for a report. Why not compile a report on the availability of other drugs? And we have no real data to show that this is an actual problem. So that's why I don't see the need for this bill.
Thank you. Representative Weber?
Thank you, Madam Chair. I see a need for the study because of the increased attacks on the availability of various sorts of reproductive health care. And we know that in this state we have places where there is less health care rather than more. And so I would very much like to see this report done. Thank you.
Thank you. Representative Merchant?
Thank you, Madam Chair. I think it's important that we collect sort of a landscape of what's happening in the state in regards to the availability of these medications. I would also say that this could be done without going through a legislative process. If the department wanted to do this, they could do it today, work with the Board of Nursing, Board of Pharmacy, Board of Medicines, places in which the data could be collected today without going through a legislative process. So I don't per se support the bill because I think there's other avenues to gain the data without having to go through a legislative process.
Thank you. Representative Weber, and then Representative Seth King.
And I would just say that it is our purview as a legislator, as a legislature, and as individual legislators to direct the department as to what information we would like to have gathered, because while they have the ability to do so, they also have, as we've said a number of times before, many other things that they are also doing. So I think this is a matter of policy for the legislature, and I think that I will be voting in favor of the underlying policy.
Representative Seth King.
Thank you, Madam Vice Chair. Is it Madam Chair? My apologies. Okay. Thank you, Madam Chair, and thank you for the correction. This bill, I just think it sets a bad precedent. I mean, how would we feel if all of a sudden the gun rights people decided to say, we need to have a bill, we need to have a report on the availability of guns in North Country because there's an attack on gun rights all across the United States and there just might not be enough people to, I mean, we could play this game for so many different ideas and this isn't going to achieve anything. If people want these drugs, they can get them. And this is more like a statement than anything real. And I don't want to see us go down that path, so I'll be voting ITL. Thank you.
Thank you, and I'll speak briefly to this. I think that conflating what's happening in New Hampshire with what's happening in the rest of the country is a dangerous idea. Here in New Hampshire, I think that the 6-week limit that we have is one that many people can agree upon. I know that when I'm speaking, when people come to me and say, I'm pro-choice, where are you? The 6-month is something that's rational to them. The state of New Hampshire, even though there are a few legislators who are putting in very early bills, those are soundly defeated. New Hampshire is a very different state than some of the other states within this union. And quite frankly, it appears that the prime sponsor of this bill may have an ability to look at this at the federal level if she's successful. But I don't think that this is really necessary to the state of New Hampshire. So that's why I had seconded it. So I don't know if there's any other discussion or if we want to, I guess we want to make sure that everybody who should be in here is actually here if we do call the vote. So let me do a check. That's 16. 16 minus 4 means we're only missing the people that we were counting on not being here. Perfect. Thank you. Okay. And with that, I will ask the clerk to call the roll.
Representative.
I'm sorry, and the motion is inexpedient to legislate.
Representative Land.
Yes.
Oh, I'm sorry. Wait just a second.
Yes.
Representative Kofalt.
Yes.
Representative Notter.
Yes.
Clerk votes yes. Representative McLean.
Yes.
Representative Seth King,
Yes.
Representative Mazur,
Yes.
Representative Nagel. I'm sorry, he's not here. Representative Polosov,
Yes.
Representative Weber,
No.
Representative McKay,
No.
Representative Freitas, Representative Cannon,
No.
Representative Nutter Upham, Representative Shapiro,
Excuse me, no.
Gary Merchant, no vote.
Oh, no, he's here. He's here.
It's all right.
That's right, it was this morning. Representative Merchant,
Could I pass? Yes.
Representative Murphy, I'll wait for you not to comment, and then I'll, okay. Representative Palmer,
No.
Representative Tejas is not here. And Representative McDonald, Representative Leon,
Yes.
10-6, motion passes.
And I'll write a minority report on not to pass.
Okay.
Thank you all for your time and being here today, and thank you for the flexibility as we were moving between here and the Senate. Representative Kofalt?
Did we finish up with 355? Or do we need to return to 355?
I think we finished 350. No recommendation on 350.
Oh, okay,
Yes.
Thank you. Sorry about that.
Yes.
Madam Chair?
Representative Seth King?
Yeah, I'd like to say a quick apology. I'd like to say a quick apology for earlier when I called the vaccine stupid. That came off as unnecessarily harsh. That was not my intention. So, sorry.
Thank you for that. Thank you. And we will see everybody bright and early tomorrow. I'm not sure. We'll see which time we're noticed for. As was stated, 9:30. Perfect. 9:30. Because we're hearing the bill the same day, so we do not need to notice as long as there's agreement between the chair and the ranking member. There's already agreement between the chair and the ranking member. The biggest question, though, is I know that some people will be getting up to testify in other bills. We'll just need to figure out how we accommodate that in order to accommodate our subs. And Representative Weber?
I would remind people that the sponsors don't actually have to be there. If you have somebody else, have them bring your remarks and your sentiments, but be here for the vote if you possibly can. But that having been said, I think it's an important bill. There was an inadvertent error, and I think it behooves all of us to cooperate in coming to a resolution. And it's also a second committee bill, so.
Yes, and thank you for that. And also, this morning, those bills had very slim representation in that, and we wanted to make sure our hard work didn't go, wasn't left behind as we moved to the other body. The ones tomorrow morning that people may be moving to are going to be longer, so they'll be able to shuffle us around. So my hope would be that we can do this. We can hopefully exec it soon after, as opposed to waiting later in the day since they are holding the calendar for us. So with that, I will close our executive session today. Thank you all, and we'll see you tomorrow.